The committee will come to order. Welcome to the first committee markup of 2024. Our first and only order of business today is H.R. 6918, the Supporting Pregnant and Parenting Women and Families Act. Today we are taking steps to stop the Biden administration's attack on pregnant and parenting mothers and families. As written, a Biden administration proposed rule at the Department of Health and Human Services could prohibit states from funding pregnancy resource centers through the Temporary Assistance for Needy Families Block Grant Program. These centers provide expectant mothers everything from diapers and prenatal vitamins to transportation and parenting classes. Yet the Biden administration is preparing to make it harder for moms to choose life for their unborn child and take care of themselves and their baby. If this rule takes effect, women in America will have fewer alternatives to abortion and less access to maternal care. Nothing in the bipartisan law that created TANF gives the Biden administration the authority to unfairly target pregnancy resource centers. The Biden administration is deliberately attempting to sidestep Congress to further its political agenda. I want to thank Representative Fishbach and Tenney for introducing the legislation and standing up for moms across America, and Representative Chris Smith for his decades of tireless leadership fighting for the unborn. I urge my colleagues to protect access to maternal care and support this legislation, and I'm pleased to yield to the gentle lady from Minnesota, Ms. Fishbach, for her opening statement.
Thank you, Mr. Chair, and I am honored to speak in support of this legislation, the Supporting Pregnant and Parenting Women and Families Act. This bill would ensure that pregnancy care centers cannot be excluded or restricted from receiving funding for temporary assistance to needy families, or TANF dollars. As defined in this bill, pregnancy centers are organizations that support the life of the mother and their unborn baby, such as pregnancy resource centers, pregnancy help centers and organizations, and pregnancy medical centers. This bill should be a no-brainer. Pregnancy centers do not just serve pregnant women. They offer a wide array of services that support mothers, fathers, and families. Pregnancy centers provide treatment, counseling, ultrasounds, parenting and prenatal education, diapers, baby clothes, referrals for housing and transportation, and so much more. They provide support for new mothers and their babies. TANF has 4 purposes, and there should be no doubt that state use of funds for pregnancy resource centers is allowable. The first 2 purposes of TANF speak to assisting needy families so that children can be cared for in their own homes and reducing dependence on government assistance. Pregnancy centers not only provide tangible material supports, but they also offer wraparound services that promote strong families and marriages. However, and unfortunately, last fall, the Department of Health and Human Services Office of Family Assistance Administration for Children and Families proposed a rule that could restrict states from using TANF funding for pregnancy centers. The administration argues that pregnancy centers should not be eligible for the centers because the centers only help women after they become pregnant. Nobody here is surprised to know that this administration prefers facilities that provide abortions up to the point of birth over pregnancy centers that support women who are choosing life. And we know many of our Democrat colleagues would like to see government funding be steered towards such facilities. But to blatantly block funding for centers that provide support for women and children illustrates the Democrats' anti-woman, pro-abortion agenda. Women who face an unexpected pregnancy should be able to safely go into a facility that is not going to push abortion on them and instead provide them with the education and resources they need to understand their options and the support available to them. Such facilities should not be at risk of losing TANF funding. I agree that statutory reforms are needed to ensure TANF dollars are focused on the intended goals of TANF. And the chair of this committee and the chair of the Work and Welfare Subcommittee have reached out to work bipartisanly, offering to work on reforms. However, singling out pregnancy centers is putting a political agenda ahead of thoughtful policy proposals that preserve state flexibility while at the same time balancing the need for accountability. Make no mistake, conservatives are here for unborn babies, children, and their mothers. And we want to ensure these moms are supported throughout their pregnancy and empowered to raise their families. This bill provides women with that opportunity. Thank you, Mr. Chair, and I yield back.
Thank you. I now recognize the ranking member from Massachusetts, Mr. Nill, for his opening statement.
Thank you, Mr. Chairman, and I want to wish all a happy new year. And I also want to express our best wishes to Dr. Ferguson as he moves on to life's next chapter. Turning to the legislation at hand, after the least productive session of Congress since the Great Depression, I had hoped that we'd open the new session on a more constructive note, working together to help people that we indeed represent. Instead, I'm quite disappointed to see that with today's agenda, the majority has farmed itself out to the arm of the former president's re-election committee. Look no further than his comments last night, amongst the many that he has offered, where he bragged about moving women from essential rights and freedoms when he called the end of Roe v. Wade a miracle. Rather than listen to women about what they and their families need or to take action to address child poverty, the majority has chosen to pursue political talking points. What's worse with this bill, we're choosing to divert money away from needy families to anti-abortion centers. This isn't about health care or reproductive freedom or even their extremely unpopular anti-abortion decision. It's fundamentally about control. Women and Republicans in this instance are on a collision course over limiting rights and opportunities for them. Our committee has work to do, and people depend on us to do so. We should be focused on addressing the maternal health care crisis in this country, which harms women of color most of all. The committee's mission is to safeguard health care. Another very good story yesterday, 20 million people signed up for the Affordable Care Act. Instead, our colleagues on the other side continue to attack it. After all, abortion is health care, and it's overwhelmingly now safe. But when health care is difficult or even impossible to access, that's when complications arise and outcomes worsen. We've seen horror story after horror story, including the one from Texas, since the Republican governor and the Supreme Court banned those opportunities. Around the country, anti-abortion centers are masquerading as health care providers, and they are jeopardizing women's health and endangering lives. One of those centers failed to correctly diagnose a woman's pregnancy in Massachusetts because the staff wasn't qualified to handle that medical care. The diagnosis gravely endangered her life and necessitated emergency surgery but a month later. These centers aren't held to the same privacy or care standards as health providers. This is not an acceptable medical care. It's horrifying that some of these propaganda centers are getting federal funding legally designated for serving poor children. This bill wants to fund more propaganda and more undeserving facilities of this kind. Women are being put in harm's way, their health is on the line, and it's all the service of a far and limited far-right ideology. Beyond that, I'd be remiss if I didn't mention that we're only 9 days away from another Republican government shutdown, the fourth in this Congress, another damaging but completely avoidable outcome that would benefit our economy and American families. We waste precious time with political stunts like this, which everyone in the room understands has no chance of ever becoming law. If our colleagues want to pass legislation that lived up to the name of this bill, we could start by addressing the growing child care shortage caused by cutting off emergency child care, funding an enhanced dependent care tax credit that Democrats championed during the pandemic, and it worked. Or they could address the historic rise of the child poverty caused by their refusal to extend the enhanced child tax credit. Or they could make paid family and medical leave a reality and spare struggling families from having to make these heartbreaking decisions between caring for loved ones and losing a paycheck. If you want to support parents and support pregnant women, let's start by helping them, not misinforming them, and certainly not by criminalizing them and making their lives harder. With that, Mr. Chairman, I yield back the balance of my time.
Thank you. The committee will now proceed to consideration of H.R. 6918, the Supporting Pregnant and Parenting Women and Families Act. Without objection, the measure will be considered as read and open for amendment at any point. At this time, I offer an amendment in the nature of a substitute, which was distributed in advance along with a green sheet explaining it. Without objection, the amendment in the nature of a substitute shall be considered as read, open for amendment at any point, and considered base text for purpose of amendment. I will now turn to Cheryl Vinson, Staff Director of the Subcommittee on Work and Welfare, to provide the technical description of the amendment in the nature of a substitute with an emphasis on the changes made since introduction. I ask that members hold their questions until after her presentation.
Thank you, Chairman Smith and Ranking Member Neal. H.R. 6918, the Supporting Pregnant and Parenting Women and Families Act, addresses regulatory changes included in a notice of proposed rulemaking published by the Department of Health and Human Services on October 2nd, 2023. Specifically, the bill relates to proposed changes to TANF regulations at Subpart B, Section 263.11, which pertain to uses of federal TANF funds that are considered to be improper. The proposed rule would amend this section of the regulations by adding a new Subpart C to clarify that if an expenditure does not appear to HHS to be reasonably calculated to accomplish a purpose of TANF, a state must show that a reasonable person would consider the use of funds to be within one or more of the 4 statutory purposes of TANF. H.R. 6918 would prohibit the Secretary of HHS from finalizing, implementing, or enforcing the changes in this section of the proposed rule with respect to expenditures on TANF on pregnancy centers. As reflected on the green sheet, the Chairman's amendment in the nature of a substitute modifies H.R. 6918 as introduced on page 2, line 4, to strike at and replace it with beginning on. The change is consistent with the intent of the provisions to correct references and make conforming changes. Mr. Chairman, that completes my walkthrough, and I'm happy to answer technical questions.
Are there any technical questions about the amendment in the nature of a substitute? Mr. Doggett.
Is the term pregnancy center, is that a medical term?
The term pregnancy center, as defined in the bill, is defined in Section 2B of the bill.
And that's the complete definition of what a pregnancy center is. It's a new term for the code then.
As it pertains to the policy in the bill.
Is pregnancy center defined anywhere else in the law, to your knowledge?
Not to my knowledge.
Yes. Is there any requirement that a pregnancy center have any medical professional or any healthcare professional of any type on staff?
The bill includes a definition of pregnancy centers in Section 2B, and it includes 2 qualifying clauses.
Yes, I see that, and I don't see any requirement that if it's a pregnancy center, that it has to have anyone on staff who knows anything about pregnancy.
The bill defines pregnancy centers to include entities that support protecting the life of the mother.
Yes, I can read the definition, and I'm just asking you if, as your understanding of the technical terms there, there's no requirement that there be anyone at the pregnancy center who knows anything about pregnancy as a medical professional.
That is not included in the definition in the bill.
So a pregnancy center could consist entirely of people who, as provided in subsection 2 there, would provide diapers and pregnancy testing, but would basically be available to promote the notion that all abortions are evil and bad.
Your question is not something that's contemplated in the bill or the proposed rule, and to the extent that it isn't related to TANF, I don't feel that I'm in a position to answer that.
Is there any purpose of these pregnancy centers other than to propagandize against abortion health care?
Again, I'm limited in my purview to respond to questions with relation to the bill, the rule, and TANF.
Thank you very much.
Further technical questions? We'll move to strike the last word. Anyone wish to strike the last word?
Mr. Doggett.
Mr. Doggett.
Thank you, Mr. Chairman. The indifference of so many extremist Republicans to the right to life of so many American women is truly shocking. Step by step, Republicans today continue their long-sought goal of a national ban on abortion, the type of ban that is already jeopardizing the health of so many Texas women, some of whom have had to flee the state of Texas in order to get medically essential care. In Texas, women like Kate Cox are among the many Texans who have been forced to travel hundreds of miles to save their right to life. Faced with the devastating news that her unborn daughter would not live and Kate's own health and fertility were at risk if she continued her pregnancy, a Texas court ignored her doctors and denied her any emergency abortion. For Austinite Amanda Zarowski, who also received the crushing news of a non-viable pregnancy that threatened her life, she was forced to linger on until the brink of death with sepsis infection before she could receive necessary medical care. In just the first 6 months of last year, nearly 100,000 women across the nation were forced to flee their states to receive an abortion. How many were unable to travel? How many of those death certificates should really list a Republican abortion ban as the true cause of death? There are no real exceptions to these draconian bans. Indeed, Texas courts have not only issued orders denying care of individuals like Kate and Amanda, the Fifth Circuit has now said that Texas can violate federal law and deny all emergency abortions. For the healthcare providers who want to offer the best medical care and practice in accordance with their professional training and judgment, Texas Republicans have placed a bounty on them. Whether you are a doctor or a counselor or even a taxi driver, anyone who assists a patient seeking an abortion may face vigilante justice in Texas. With doctors intimidated out of giving necessary medical advice, women are being denied care under heart-wrenching circumstances like what happened to Kate and Amanda. Maternal and infant mortality rates, which were already bad in Texas compared to other states, they're getting even worse. Medical professionals, many are fleeing the state of Texas themselves and choosing to practice in a state where they can use all of the tools available through their professional medical education. Meanwhile, Republicans continue their march to eliminate freedom everywhere in all 50 states. Abandoning years of bipartisan tradition on essential legislation to keep our government operated and funded, we have Republicans now that are insisting upon dangerous provisions to eliminate the very few remaining protections, overturning science-based decisions by the Food and Drug Administration to permit mail order for medication abortion, abandoning service women when they need necessary medical care, and eliminating Title X funding, all on a path to criminalizing abortion everywhere. Under this particular bill, Republicans now also seek to waste taxpayer dollars on what are clearly, by the definition of the bill, anti-choice propaganda centers, disguised as pregnancy crisis centers, posing as healthcare facilities with intake forms, medical jargon, staff in scrubs. Most of these centers do not have a single licensed medical professional or staff member. They rely instead on anti-abortion care propaganda and misinformation to discourage vulnerable women that are facing some of the toughest economic and healthcare decisions that they may ever make. These centers do themselves not protect patients, but they endanger them. They're a sham, and they should have no right to taxpayer dollars. For every Texan that is being offered fewer rights today than their grandmothers enjoyed, for every expectant parent whose life is threatened by Republican interference, I strongly oppose this bill, and I yield back.
Ms. Tenney is recognized to strike the last word.
Thank you, Mr. Chairman. I am so pleased to be here and so grateful to my colleague sitting next to me, Representative Fishback, in co-sponsoring the H.R. 6918, the Supporting Pregnant and Parenting Women and Families Act. This vital piece of legislation would prevent the Department of Health and Human Services, through a proposed rule, from unfairly limiting the ability of states to spend temporary assistance for needy family funds, otherwise known as TANF, on pregnancy resource centers. This Biden administration proposed rule circumvents congressional authority and far exceeds the statutory limits granted to HHS. In addition, it would jeopardize the thousands of pregnancy centers across the country that rely on TANF funding to support life-affirming services for millions of Americans. Not only do pregnancy centers provide critical resources for pregnant women seeking to bring life into this world, but they also offer pregnancy testing, ultrasounds, parental education, counseling, and connections to housing and transportation. I find it unconscionable that the HHS would attempt to restrict states from funding these centers while simultaneously supporting funding for programs connected to Planned Parenthood, giving Americans the tools to be successful in the workplace. Promoting life-affirming and compassionate care for women and children are causes that should garner unanimous support from members of Congress. It is vital that these pregnancy resource centers continue to receive funding to ensure the well-being of all families across our nation. We should do everything we can to promote access to the kinds of services that pregnancy centers offer, not limit them through this proposed Biden administration HHS rule. I'm honored to support this bill and look forward to its passage out of this committee, followed by swift consideration on the House floor. It's the right thing to do. It's the compassionate thing to do. And these centers are lifesavers, not just for children who are saved from abortion, but also for the women who receive care in a lifelong setting and support for these children. I yield back.
Mr. Thompson is recognized to strike the last word.
Thank you, Mr. Chairman. You know, it's a heavy lift to get on this committee. All of us worked really hard to get here. Everybody else in Congress wants to be here. This is a significant committee. Consider that there have been 8 presidents who were members of the Ways and Means Committee, 3 of which were the former chairs of this committee. And there's a reason for that. This committee does important work. We've passed some of the most significant bills in the history of the Congress. Everything from recently the Affordable Care Act, USMCA, to the Social Security Act establishing Social Security, and then the amendments to that in '65, which created Medicare and Medicaid. The CARES Act during COVID, which really is one of the reasons why we are so far ahead of our allies around the world in the recovery from COVID and the economic problems that brought to us. The Trade Expansion Act of 1962, that allowed presidents to use tariffs in order to deal with economic issues. Those are the types of important policy that we should be working on today, not advancing an anti-woman's health agenda, policy that puts women's lives in danger. In my home state of California, which has been on the forefront of protecting women's health care, crisis pregnancy centers outnumber abortion clinics 11-2. Less than 2/3 of the counties in California have abortion clinics, but nearly 80% have at least one crisis pregnancy center. The California Attorney General recently announced a lawsuit against 5 of these centers in Northern California that are alleged to have used fraudulent and misguided claims to advertise an unproven and largely experimental medical procedure known as abortion pill reversal. Are these the types of facilities that support families in poverty? Is that what we want to be supporting? Those are the types of things that we want to be supporting? We all know the real reason we're marking this up today in this committee. Our Republican colleagues want to showcase their anti-abortion platform before this year's March for Life event, which is about a week away. This is yet another attempt by our Republican colleagues to push forward their anti-choice, anti-woman, anti-abortion agenda. Since the Supreme Court overturned Roe v. Wade and stripped away the constitutional right for abortion, Republican legislatures across our country have been passing draconian anti-abortion laws, severely restricting and outright banning abortion, leaving millions of women without access to reproductive health care. Many Republicans told us that overturning Roe returns the issue of abortion to the states. But as we're seeing here in this committee today, that's not the case. Again, this is just another attempt to push an anti-abortion platform. An abortion is an extremely personal decision that should be made by women in consultation with their family, their faith, and their doctor, not by Republicans on this committee or any other committee. Republicans want to continue stripping away reproductive care for millions of Americans. House Democrats will not allow that to happen. We'll continue to fight on this, and I urge a no vote. I yield back the balance of my time.
Ms. Miller is recognized to strike the last word.
Thank you, Mr. Chairman. I move to strike the last word. As a woman, a mother, and a grandmother, it was deeply fulfilling to me to watch my children and grandchildren grow up to be healthy and happy. I am in awe of the miracle of life, of conception, and passionate about the sanctity of life. It is our role to support women and families as they raise the next generation. Being a mother is no easy task, especially if there is an unexpected pregnancy. Pregnancy resource centers fill a unique and specific need to provide women and families with the support and wraparound services needed to help raise a child. I have been able to visit my own local pregnancy resource center in Huntington, West Virginia, and the individual care that they provide to parents is nothing short of a blessing. Pregnancy resource centers go beyond offering counseling solely after a woman becomes pregnant. They deliver free services on a voluntary basis to expecting parents, ensuring that children can be cared for within their homes. These comprehensive services include free pregnancy tests, ultrasounds, testing for sexually transmitted infections, counseling on all options for pregnancy, parenting education, job training, diapers, and baby clothes, assistance with housing and utilities, and transportation support. This bill affirms our support for women and families and will help ensure that they are provided the resources that they need. I applaud Representatives Fischbach and Tenney for introducing this vital legislation, and I look forward to seeing it reported favorably out of committee today. Thank you, and I yield back.
Mr. Larson is recognized to strike the last word.
Thank you, Mr. Chairman. And before I do, on a lighter note for the committee, I just want to remind everybody that next Thursday evening, we're celebrating Mr. Pasquale's 7th annual 90th birthday, and at the luxurious VFW compound, and I hope all of you can make it there. I like to associate myself with the remarks of Mr. Doggett and Mr. Thompson. And listen, I have nothing but great respect for women on this committee who have proposed legislation, and deeply concerned just listening to what you have to say about the sanctity of life. I don't know anyone on this committee that isn't and doesn't care deeply about that. But when you see, as Mr. Doggett pointed out, people in Texas fleeing for their lives, women in Tennessee concerned about their lives, that's the sanctity of life as well. And it's a subject matter area that tugs at everybody's heartstrings. But at the end of the day, is it a governmental decision, or is that a decision between the individual, their doctor, and their conscience? Government can do an awful lot of things, but when it comes in a very constructive way. But when we see the adverse effects and the jeopardy that that places so many women in, it's unfair. It's not right. And that's why I join with my colleagues in opposing this legislation. And I say that with great respect for the individuals who have, I know, in putting forward this legislation, care deeply about the sanctity of life, as do I. But that goes both ways, and especially as it relates to women who have less means, women who are impoverished, women who don't have the opportunities that many of us do. And with that, Mr. Chairman, I'll yield back my time.
Thank you. Ms. Still is recognized to strike the last word.
Thank you, Mr. Chairman. I move to strike the last word. I am proud to support the legislation introduced by my friends, Representative Fishbach, and Representative Tenney. The Supporting Pregnant and Parenting Women and Families Act is a very simple, common-sense step to help ensure that pregnancy centers can still receive temporary assistance for needy families funding. Pregnancy resources centers play a key role in assisting vulnerable mothers and fathers and fostering a culture of life. Giving family support in their decision, and encouraging those who are considering abortion by providing them more options to move forward with their pregnancy. In many cases, they provide free testing ultrasounds, parenting classes, linkage to housing, job counseling, and resources for adoption. This is very important for these pregnant women. Pregnancy centers are a vital tool for empowering women who choose life for their child and empowering states to address the root causes of poverty and reduce dependency on government. I hope we can all agree that pregnancy centers meet the statutory purpose of organizations that qualify for temporary assistance for needy families and save taxpayer dollars through the work they perform for free through volunteers and charitable contributions. H.R. 6918 supports a woman's right to choose life for her and her baby. Thank you. I yield back.
Mr. Pascarell is recognized.
Morning, Mr. Chairman. Happy New Year. There are two things that really get me ticked off, amongst many others. There are two things that really grate me. And it's coming down to our responses to these two things that overwhelm all the rest of the issues that we're going to putz around with between now and Election Day. Let's be clear. A woman's right to make decisions on her own health care must be protected, full stop. We want to protect family health, then let's restart the expanded child tax credit permanently. Now, the two things are, we get accused, Democrats, of pushing open borders. I'll get into that at another time. I have never heard, I've been here 25 years, never heard a Democrat advocate for open borders, people coming each way over the border at will. But you've accused us and put into the folks' minds for the last 25 years that we want to see no stoppage at the border. Just open them up, let them come in, the rapists, the drug dealers, to quote your leader, etc. The other thing is, you put us in a position on the issue that deals with, as Larson said, Congressman Larson, the sanctity of life. If we don't approach the sanctity of life with sanctity, then I think it becomes a number, it becomes an issue that is not personal. There's nothing more personal. We are not amoral people on this side of the aisle. So the discussion about when you can perform an abortion, I think is a legitimate issue. I really do. Brought about Roe versus Wade. But we look at this in a moral way also. Our enhanced child tax credit is one of the most successful laws we've ever enacted. Look at the data, both sides. It cut child poverty in half. That's either true or it's not true. But every member of the other side voted against it and blocked its expansion. The Supreme Court's decision to overturn Roe versus Wade is one of the lower points in our history. But we worked out, with tongue-in-cheek, a compromise. Some red states are now criminalizing life-saving procedures, shuttering health clinics, and trying to throw women and doctors in jail. Harassment and violence are skyrocketing. Today's bill is yet another attack, I think, on women's health and freedom by propping up these dangerous centers with taxpayer money. God, I can remember this debate going back in the IRS situation where we tried to put people in jail, expose their tax returns because of the debate that was going on at that time, if you remember the Lerner case. These unregulated non-medical facilities often deliberately mislead women on their health options. Don't take my word for it. The American College of Obstetrics and Gynecology has warned that anti-abortion clinics can gravely endanger the lives of pregnant women. That's what they say. We must say no to this bill. TANF is an invaluable resource for children and families. In my state, TANF provides health guidance and aid to new parents. Let's support successful programs that lend a helping hand to the working family instead of sabotaging women's reproductive care. No one is absolutely right on this issue. I don't care where you stand. We are human and we are trying to reach an answer, but we better do it together or else this will be duplicated 20 years from now. Thank you, Mr. Chairman, and I yield back.
Thank you. Ms. Malliotakis is recognized to strike the last word.
Thank you, Mr. Chairman. Let's be clear. The Biden administration's anti-woman, anti-mother, anti-family rule would deny valuable assistance to pregnant women, women who are mostly single and minorities, by restricting states from using temporary assistance for needy families funding for pregnancy centers. There are over 2,500 pregnancy centers across the country providing life-affirming services and material support to 2 million people, including pregnant women, parents, couples, and families. Pregnancy centers that are offering important items, services to mother and unborn children, including pregnancy testing, ultrasounds, prenatal and parenting education, birthing classes, diapers, baby clothes, housing, and transportation. It's shameful what the Biden administration is doing to women that they claim to help. I have pregnancy centers in my district. I assume most of us do. They do great work. They help women in need, oftentimes have nowhere else to turn. They may not want an abortion. They may want to have a baby, and they need support. And clearly, abortion is the only option that this president wants to give them. So what's wrong with having the option to have the baby and get support? And by the way, these centers are 90% funded privately. 80% of them receive no government funding whatsoever. And now the Democrats are looking to take away what little funding, about $16.5 billion that they do receive. Last year, we saw a pregnancy center in New York State in Buffalo firebombed, and it was vandalized, left 2 firefighters injured. So let's stop the rhetoric here about what's really happening at these centers. They're supporting these women who want to have a baby, these families who need help, and they provide good services. And I support this because I think it's a disgrace that they're looking to cut what little funding they receive now. Thank you, and I yield back.
Mr. Davis is recognized.
Thank you, Mr. Chairman, and I move to strike the last word. As we again face another Republican-manufactured shutdown crisis, the Republican leadership advances this bill to divert money intended for poor children to dangerous anti-abortion centers. Shifting funding to support crisis pregnancy centers only reveals the Republican intent to trample on women's rights from achieving health equity and the right to choose their own best health interests. According to the American Medical Association Journal of Ethics, these pregnancy centers seek to intercept women with unintended pregnancies who might be considering an abortion. The pregnancy center's purpose is usually to prevent abortions through misinformation and not following HIPAA standards and medical best practices with respect to patient-centered care. I strongly oppose H.R. 6918 for the reason that it is just another step by the Republican leadership to advance their extremist war on women and women's health. In my opinion, this committee should take immediate action to eliminate child poverty, not promote efforts to restrict women's reproductive choices. Alarmingly, just 1 year after the Republican-led expiration of these poverty-lowering investments in workers and families, the child poverty rate more than doubled, causing the biggest one-year increase in poverty we've ever seen. If Republicans truly wanted to help pregnant and parenting families, they would fully restore the child tax credit, dramatically increase child care funding to address the child care crisis, enact comprehensive paid family and medical leave, and make it easier to get critical services like Medicaid. Due to strong federal investments by Democrats and President Biden, especially the expanded child tax credit, child poverty precipitously dropped by almost half between 20 and 2021, the lowest rate on record ever. The progress we made in 2021 shows that we can slash child poverty when we have the political will to act. Every day we delay action, poverty poisons the future for millions of our children and for our nation. To this bill, I say no and yield back.
Mr. Smith is recognized.
Thank you, Mr. Chairman, and certainly thank you to all of our members here today and the sponsors of this bill, Ms. Fishbach and Ms. Tenney. I hope that we can reflect on what TANF is supposed to be about. It's about helping people in need. I would say, in fact, it's about helping the folks most in need. And when we look at what is being done across America, this very large country with varying perspectives, that when there are organizations who help folks so acutely in need and in a very efficient manner, I think we should take note. We should not disqualify. And the fact that pregnancy centers would be disqualified because of their point of view, basically, I have concerns about that. But I hope that as we focus on helping people in need, and it's not just about checking the box that someone got a job, but how they can be successful and get on a trajectory to not only help themselves, but in many cases, help a young family, and certainly the folks most in need. So as we move through this, I hope that we can reflect on the fact that many clients of pregnancy centers, patients of pregnancy centers, are comfortable with the approach that they are pursuing and also need the benefits that can be offered through TANF. So let's not exclude. Let's work together to make sure that we can meet the needs of folks most in need. I appreciate my colleagues talking about the child tax credit. That's working its way through the process on a bipartisan basis, and I think we should be proud of that. Moving forward, though, let's make sure we meet the folks where they are, and especially when they are in need, and not exclude them from TANF funding. Thank you. I yield back.
Ms. Sanchez is recognized.
Thank you, Mr. Chairman. You know, as we sit here debating whether Treasury or temporary assistance for needy families should be diverted from children and parents who need it, my colleagues across the aisle are 8 days away from forcing a partial government shutdown that would only hurt working families. If Republicans want to help children, they could start by addressing the historic rise in child poverty in this country, the need for paid family and medical leave, or the growing child care crisis. While Democrats are laser focused on expanding the child tax credit to help address these pressing issues, Republicans are fighting to reroute TANF dollars away from children and families who rely on it. An expanded child tax credit would target the 19 million children who are currently excluded from the full $2,000 credit. That includes an estimated 2.3 million families in California alone. The so-called pregnancy crisis centers are really just anti-abortion centers, and my colleagues on the other side of the aisle absolutely said that they have a specific agenda and perspective in mind. But many of the women that are referred there or that go there seeking help don't know that they're going to a one-sided facility that is trying to coerce them into a certain outcome. Anti-abortion centers is a more apt name, I think, for these centers, and they only target women who are already pregnant and therefore cannot meet TANF's stated purpose of reducing out of wedlock childbearing or promoting family formation. So we're taking TANF dollars away from TANF and we're putting it into these centers who don't even support the mission of TANF. Not only do anti-abortion centers fail to fulfill the congressional intent of the TANF program, but they also misrepresent themselves as healthcare facilities. I don't have a problem with pregnancy crisis centers, but they misrepresent. They lie to women, or they give the appearance of being a healthcare facility when in fact they are not. Time and time again, they have used false information, emotional manipulation, and have even unscrupulously delayed care to divert access to comprehensive, appropriate health care from licensed medical professionals. In fact, a 2006 congressional investigation found that 87% of surveyed anti-abortion counseling centers provided false or misleading information about abortion. How's that for operating an honest, helpful, ongoing concern? They purposely provide false and misleading information about abortion because they have an agenda, a specific agenda that they're trying to promote. But many of the women that walk through those doors are not aware that they're promoting this agenda. These centers cause delay in accessing legitimate health care, often for minors who are not even adult to make adult choices. Instead of funding facilities that endanger public health with federal dollars, let's work together to put more money into the pockets of working families. Let's put money into TANF for TANF's legitimate purposes. Let's not pretend that these centers are doing poor and minority women a favor by misleading and lying to them to get the desired outcome of an extreme agenda. And with that, I yield back.
Mr. LaHood is recognized to strike the last word.
Thank you, Mr. Chairman, and I move to strike the last word. This past October, the Department of Health and Human Services issued a proposed rule that singles out pregnancy resource centers and preemptively suggests these would no longer be allowable for state TANF expense due to the assertion that they would not be, quote, reasonably calculated to accomplish a TANF purpose. As Chairman Smith and I pointed out in our comment letter to HHS on this proposed rule, the changes offered in this proposed rule are in clear violation of congressional restrictions placed on the department's ability to regulate. When TANF was created with bipartisan support in Congress and signed by President Clinton in 1996, the overarching goal and stated purpose in statute was, quote, to increase the flexibility of the states, unquote. Likewise, the committee report emphasized the importance of state flexibility 7 times and stated that TANF's purpose is to, quote, increase state flexibility in providing assistance to needy families, unquote. To protect this purpose, Congress explicitly limited the ability of the executive branch to issue regulations for the TANF program. Section 417 of the TANF statute states, quote, no officer or employee of the federal government may regulate the conduct of states under this part or enforce any provision of this part except to the extent expressly provided, unquote. Not only should any new restrictions on TANF state spending be done through legislation as opposed to regulation, but this proposed rule unfairly singles out crisis pregnancy centers and preemptively suggests that funds to these entities would no longer be allowable TANF expenditure should the proposed rule become final. Pregnancy centers are an important and vital alternative for expectant mothers, and unilateral efforts to limit the funding sources available to them will only hurt women and families. For one example, in the state of Illinois, the Women's Care Center, of which there are actually 35 locations across 12 states, serves as the largest pregnancy resource center in the United States. The one in Peoria, Illinois, serves 1 in 5 women in the Peoria area and surrounding counties. In 2023 alone, the Peoria Center had just shy of 47,000 total visits, performed nearly 8,000 total services, and assisted in the delivery of 620 newborns. It's an absolute asset to our Peoria area. The bill before us today, the Supporting Pregnant and Parenting Women and Families Act, prohibits HHS from finalizing, implementing, or enforcing this or any similar rulemaking that would restrict the use of TANF for pregnancy resource centers. I want to thank my colleagues, Ms. Fishbach and Ms. Tenney, for their leadership on this issue and urge my colleagues to support this bill and the vital services pregnancy resource centers provide to women and families and our communities. And I yield back.
Ms. Sewell is recognized to strike the last word.
Mr. Chairman, I move to strike the last word. I am disappointed today because instead of making and using this opportunity to improve the safety net for working families and mothers, this Republican bill is diverting temporary assistance for needy families, TANF funding, to centers that do not provide women with the necessary comprehensive medical care to improve health outcomes in our communities. In 2022, only 7% of Alabama families living in poverty received a TANF cash assistance benefit. This is far below the more than 167,000 Alabama families that currently live in poverty. For those families that do not receive TANF benefits, the state of Alabama only provides an average $215 a month for a family of 3. This is the lowest, the second lowest cash benefit amount in the country. I cannot support legislation to allow for a diversion of already limited TANF funds to these so-called crisis pregnancy centers, while 161,000 families in my state go without access to this cash benefit that is expected to be used for families to provide basic necessities for their children. Quite frankly, we need to provide more direct support for working families in our districts who are trying to climb out of poverty. In 2021, only $14 million out of the $196 million of TANF funds sent to Alabama was actually given to direct cash assistance families. I think what I'm saying is we should be spending our time making sure that these resources go to the families that they're supposed to go to and not divert these funds for other purposes. If we divert limited TANF funds to crisis pregnancy centers that do not provide comprehensive health care to women, then states will continue to bypass providing families living in poverty with needed assistance to help make their ends meet, like my state of Alabama. We must ensure that the funding that we're responsible for overseeing is solving the problems that it's intended to address when Congress created this program. Let's vote no on this new rule, and let's get back to the business of making sure that we're taking care of all working families. Thank you, and I yield back.
Dr. Winstrip is recognized.
I move to strike the last word. I'd like to say that I'm very familiar with pro-life agencies. Pro-life agencies consider life-saving procedures as life-saving procedures, not as abortions. But I want to say that there's thousands of pregnancy centers across the United States today serving millions of people and providing critical support to mothers and fathers and the expecting child. Mothers choose to enter willingly and voluntarily into a pregnancy center. It is a freedom. It is a choice. No one is dragged in there, and no one is forced to continue service there. I'm curious if any of my colleagues have actually spent time in a crisis pregnancy center to truly understand the vital support that they provide. Personally, I know a couple of my friends that are OBGYNs that are volunteer medical providers at pregnancy centers. I met a medical doctor who serves as a medical director for a pregnancy center that specifically takes care of pregnant women with addiction. That is not a bad thing. I was shocked to see what HHS has had to say, and it was just mentioned earlier. Meet the TANF purpose of preventing out-of-wedlock births. It doesn't even say possibly reducing out-of-wedlock pregnancies. It specifically says preventing out-of-wedlock births. Frankly, I thought only a heartless country like China would callously and overtly and expressly prevent birth. To make it a goal to prevent birth. That needs to be changed. Last Congress, we worked hard to pass the Maternal, Infant, and Early Childhood Home Visiting Program, MCV. We did that in a bipartisan effort. In my experience, and I've witnessed both this program and pregnancy centers, they do about the same thing. They support low-income, high-risk pregnant women and parents and their babies to enhance the overall health and outcomes for a mother and a child. Quite frankly, from what I hear today and what I've heard in the past from the other side, I can't believe we passed MCV in a bipartisan fashion. But thank you for having a heart at that time to pass that, because they have the same goal, the exact same goal. Pregnancy centers want healthy mothers and healthy children, healthy Americans. I had a patient who sent me a letter one time, an older lady, suggesting I meet a young woman that she knew. And she knew this young woman because she was a volunteer at the pregnancy center. I didn't meet that young woman until a couple years later. She's now my wife. She volunteered at the pregnancy center, and let me share a story with you. She took on caring for and working with a young lady about 20 years old who was raped and was pregnant, who felt that that was not the child's fault in her womb. And she wanted to let that child have an opportunity to live. That's a tough thing to do. My wife worked with her. This woman went on, had her child. She put the child up for adoption. About 5 years later, she gets married herself. That little girl was the flower girl in her wedding. That woman has now had 2 of her own children and adopted a 3rd. You tell me what is wrong with any of that. That is a beautiful story. And I am so proud that my wife had something to do with caring for someone and providing a better life, not just for one person, but for 2, and ultimately for 3. Let's not let HHS put an end to this type of beautiful work that's being done in Ohio, and especially for those who choose that option. I yield back.
Ms. Chu is recognized to strike the last word.
I move to strike the last word. It is astounding and frankly shameful that in the current state of reproductive rights in this country, our Republican leadership is spending this committee's time attempting to funnel taxpayer dollars to organizations that intentionally lie to, mislead, and endanger women. These so-called crisis pregnancy centers are fake women's health clinics designed to dissuade women from seeking abortion by spreading misinformation. They often disguise themselves as genuine health centers, even going so far as to dress their staff in scrubs or white coats to mimic medical professionals. Because these anti-abortion centers are not actual medical facilities, they are not covered by the privacy and security rules of HIPAA. And therefore, their staff can say whatever they want without consequences. So these centers pose as medical facilities, spread misinformation about abortion, and then face little, if any, consequences for doing so. This has profound impacts for the patients that find their way to these centers believing falsely that their staff are real medical professionals. In Iowa, an OBGYN has seen patients who visited these centers. These patients were told that using contraceptives was the same as having an abortion. They were told that using birth control could give them cancer and would change their overall health. This OBGYN has seen patients who've had miscarriages and ectopic pregnancies because they were misdiagnosed by these anti-abortion centers. These women were told that their pregnancies were in the early stages or that they were experiencing normal amounts of pain because the staff members they saw were not actual qualified medical professionals. As a result of this substandard care, these women showed up to the hospital needing emergency care and surgery to save their lives. Because they are not healthcare facilities, these anti-abortion centers can share patient information with anti-abortion networks that fund them. This information can and has been used to surveil, harass, pressure, or prosecute those seeking abortion care. A former volunteer at one center in Iowa has come forward to say that she witnessed staff threatening patients that they would call their family members or partners to let them know that they were pregnant. Do you understand how dangerous that can be for a victim of domestic violence or family abuse to have their pregnancy status disclosed? This could mean additional abuse, violence, or even death for some women at the hands of their abusers. And this demands the question, whose lives are these centers really interested in protecting? Now, TANF dollars are incredibly important anti-poverty tools, but instead of investing in childcare, employment assistance, or programs to help families afford their rent, we are debating a bill today to send more public funds to these deceitful and dangerous anti-abortion centers. If my Republican colleagues truly wanted to assist expecting parents and lift children out of poverty, I would welcome their partnership on our efforts to establish a national paid family leave policy. I welcome any partnership to increase funding for Title X, the nation's only dedicated source of family planning funding, which hasn't seen an increase since 2014. Or they could join us in investing in our nation's badly under-resourced child care system. But instead, they choose to spend our valuable time on bills dedicated to further trampling women's reproductive rights after the disastrous anti-freedom Supreme Court Dobbs decision. It's clear where their priorities lie. I urge my colleagues to vote no, and I yield back.
Mr. Kelly is recognized.
Thank you, Chairman. I move to strike the last word. And I agree with my good friend, Mr. Neal, about the purposes of this committee. And so what the issue today really is about funding, though, isn't it? I know we get into this pro-life, pro-choice, pro-whatever it is or whatever we're against, and it's become a political issue. It's not really a life issue, is it? Dr. Wenstrup's testimony was really moving. I know that after our first child was born, then we went through an ectopic pregnancy, and then we were blessed shortly after that. Our second son was born. Now, we didn't need the help of TANF. We wouldn't have qualified for it, but I'm just trying to understand. So TANF provides $16.5 billion in federal funding to states to further force statutory purposes, provide assistance to needy families so that children can be cared for in their own home or in the home of relatives, and the dependence of needy parents on government benefits by promoting job preparation, work, and marriage, prevent and reduce incidence out of wedlock pregnancies, and encourage the formation of two-parent families. I don't know how we got to this point, and I guess politically we can score points on it when it comes to well, woman's right to health care, and part of the health care is to an abortion if that's what's determined by the mother. I would really like to get down to what it is that the committee does do, and it is about using the time that we have to work on policies that make sense to the people that we represent. Not just Republicans that we represent, or Democrats that we represent, or Libertarians, whomever it may be, but the American people. I've just often been perplexed by the issue that comes down to the right to end a pregnancy or abort a child. And if that's really the most important issue that we face every single day, and we use it as a political cudgel, I mean, is that really who we are? I just don't understand anymore what it is. And if you want to help somebody who is not in a position economically to get through a tough situation and help them, the sum is that you lied to them, you cheated them, you gave them false information, and you prevented them from aborting a child. I mean, how bizarre is that as an argument? So we often talk about our population, and we say 25% of the population is what we consider youth, and 75%, I guess, are the more mature adults. I don't understand half of that, but anyways, let me just say this. If that is truly the most important asset we have as a nation, then why are we so careless when it comes to political activity as opposed to policy that would make the most important impact on the future generations of America? Yes, there will be a March for Life. And the Supreme Court ruled, when overturning Roe versus Wade, that this goes back to the states individually to make a determination on this, and let those individuals of those states talk to their legislators to come up with policy they think they should have. I love the pro-choice part of what it is we do, hoping that the choice would be life. And I'm going to suggest to every member of this panel today that after we have this discussion again, which is a political cudgel, to take a few minutes out of your day, if possible, to call your mother and thank her for being pro-life. It really enabled you to be here today and to continue this battle, which is senseless to me. If we really are the country we say we are, if we really say we are the nation that we say we are, if we really believe in what it is that we say we believe, why do we have these pointless conversations that we use as a political advantage? I find it absolutely disturbing and has nothing to do with what we do when we come here. We are here representing 750,000 people back home. Could we please talk the right way? And I would say, why would you ever take funding from these centers that help people who are in need? That makes no sense to me at all. Mr. Chairman, I yield back, but I do agree this committee has an awful lot of things to cover. I'm glad we're covering this today, but we have a lot more that we have to get to. Thank you so much. I yield back.
Ms. Moore is recognized to strike the last word.
Thank you so very, very much. And I was really excited to come to this meeting today. It appeared on my calendar as a Start over. I want my time back. Let me see. What happened? This is this one. Thank you so very much. Can you hear me? Okay. I just really appreciate my colleagues convening on this topic. And I was very excited when I looked at my calendar to see that I was going to be considering a pro-life bill. And then the title of this bill, Supporting Pregnant and Parenting Women and Families Act, made me even more excited. But then, of course, when I got here, realizing that there was nothing here that was really going to support and parent pregnant and parenting women. I thought maybe we were going to come and talk about expanding the child tax credit or expanding CHIP program so that kids could get good dental services. Maybe there was going to be we're going to talk about taxing, a tax credit for providing fruit and vegetables for kids during their formative years. I thought maybe we would be talking about a tax regime other than the feudal property tax system so that our kids could get a better education. Thought maybe we'd be talking about a tax credit for child care. And then when they start talking about wraparound services, my God, really intervening in people's poverty and the high price of housing, where people are paying 50 to 75% of their income for housing, dealing with the lack of formula that women have. And instead, we're talking about diverting a measly $16.5 billion for the TANF program to these 2,500 centers that don't meet the goals of the TANF program. I heard one of my colleagues talking about the flexibility. One of the things that I've resented most about this program is the so-called flexibility. I've had people in my district build roads with TANF dollars for luxury apartments. And I have to admit, I'm a fan of the Packers. I'm a fan of Brett Favre. But I tell you, the people in Mississippi say that he is their welfare queen. Is this political versus life? No, we're talking about a pro-birth bill here today, not pro-life. Because if we were talking about a pro-life bill, we'd be talking about the day after Junior was born. Whether or not, we were going to whine about how much Medicaid costs to bring him into the world. Whether or not we were going to debate cutting fruits and vegetables out from a growing brain, Dr. Winstrom. Whether or not we were going to talk about intervening a child tax credit. And so I just think it's very disingenuous to call this a Supporting Pregnant Parenting Women and Families Act when it only supports you through crowning, through birth. Now, I just want to establish my expertise on this subject in my remaining moments. I'm a mother, and my child, my eldest child, just turned 54 on New Year's Day. I have 3 children. I have 3 grandchildren. I have 3 great-grandchildren. I've held these women's hands, my daughter and granddaughters, that they've brought life into the world. I've held the hands of women who went through an abortion because of circumstances in their lives that didn't didn't provide them with the opportunity to give birth at that time in their lives. I've walked down the street to my neighbor's house when their brand new baby boy died from an unknown cause. And so I can tell you, I'm pro-life. I'm pro-life for 2 seconds after you're born until you are able to take care of yourself. I'm not just pro-birth. And I just think that 2,500 of these centers that only support you to stay pregnant and don't support you beyond that is a farce. And it's just some more corporate welfare that we are providing and diverting these funds from people who need it to stay in their homes and to feed their kids. And with that, Mr. Chairman, thank you for your indulgence. I would yield back.
Thank you. Ms. Van Dyne is recognized to strike the last word.
Thank you very much, Mr. Chairman. You know, and we're prohibiting HHS from finalizing, implementing, or enforcing this rule or any other similar rulemaking that would restrict the use of TANF for pregnancy centers. But Democrats here are arguing that Republicans don't care about children after they're born. Yeah, up until crowding. Yet this proposed rule would strip crucial resources from families offered by pregnancy centers. You know, and I'm not going to apologize for supporting a, quote, pro-life bill, but I will totally take problem with the previous speaker saying that this is only about birth, that this is not about pro-life. This is only about concerns of holding a mother captive for pregnancy. This is absolutely not. Perhaps the gentlelady actually needs to do research on some of the resources.
Would you like me, would you yield?
Excuse me, I have the floor.
Me.
No, I will not yield.
Well, then don't
I have
talk about
the
me
floor.
then.
I will not yield.
Don't mention me if
I
you won't
have
yield.
the floor and I will not yield.
She has not yielded.
You're accusing me of things that aren't true.
I was just repeating
Stuff I didn't
exactly
say.
what you said.
The gentle lady does not yield. She has the floor.
Democrats are arguing this question. The fact is that if they actually did their research and they found the services that are provided by pregnancy centers, you would see things like maternity and baby clothing, formula and diapers. I don't know about you, but I don't know how many children in a womb actually need formula and diapers. Unplanned pregnancy, childbirth, and parenting classes. You need to parent for a child who has been born, not for one that is in the womb. Adoptive information. To be able to take the baby that is born healthy, and make sure that they've got parents that want them. Looking at assistance for education and career decisions. Training and life skills. Housing and support services. Those are all services offered by pregnancy centers that Democrats want to cut. They sit here and they say that these centers are actually decreasing the number of choices available for women. That is absolutely not correct. You are taking away the choices that women have by having these birthing centers and wanting to cut their funding. And Texas has about 200 pregnancy centers. California has at least 176 pregnancy centers, and at least 5 states distribute a portion of their TANF funding to pregnancy centers, including Indiana, Louisiana, Missouri, Ohio, and Pennsylvania. 18 states, including Texas, have authorized state funding for pregnancy centers. In 2023, the state legislature approved $165 million over 2 years for pregnancy centers through its Alternatives to Abortion program, more than double the 2019 budgeted amount. It's important that states have the option to use TANF funds to support programs that not only provide these resources, but they're providing them at no cost. This reduces the dependence on the federal government. Maternal mortality is a problem in this country that disproportionately affects Black women. According to the Centers for Disease Control and Prevention, in 2021, the maternal mortality rate for Black women was 69.9 deaths per 100,000 live births, 2.6 times the rate for white women. In 2022, CareNet network of 1,200 affiliated pregnancy centers provided invaluable prenatal and postpartum services to 334,294 clients, 47% who identified as people of color, including 80,231 clients who identified as Black and 66,859 clients who identified as Hispanic or Latino. In comparison, In 2019, Planned Parenthood stated 39% of their patients identified as persons of color. We should be supporting organizations that provide prenatal and postpartum services to people, not restrict them, as this is an all-hands-on-deck situation. Democrats' proposal to strip funding from pregnancy resource centers will only serve making minority women's lives harder. And with that, I yield.
Mr. Kildee is recognized.
Thank you, Mr. Chairman. I'll just say one thing quickly, then I'll yield to my good friend, Ms. Moore. There can be a legitimate debate about some of the aspects of this, but I don't think we should have it lost on anyone who's listening that there's a fundamental difference between Democrats and Republicans on this issue. Republicans do not believe, to a person, do not believe that women should be able to make this fundamental decision for themselves. They believe that government knows better than they do about their own reproductive rights choices. And that is the fundamental question that underlies this entire debate. With that, I happily yield the remainder of my time to Ms. Moore.
I just want to thank you, Mr. Kildee, for yielding the time, and I don't really need all this time to say a couple of things. First of all, I just want to say I would appreciate any service that want to make some intervention in a woman's life and to give her some advice and counseling. I mean, like I said, I've held their hands when they were pregnant and giving birth. I've held their hands when they were having an abortion. I've knitted baby blankets. I've done the whole thing. I just want to give some definitions since you wanted to do that. Postpartum is 6 weeks after you're born. So if people are giving you formula and diapers and sending you home with a nice little kit, I think that's really cute for 6 weeks. You know, and that doesn't justify getting on the floor of the house and voting to cut.
You had said
no, I will not yield to you. No, I will not. It's my time, Mr. Kildee's time. You know, so I think it's really nice. You know, you get a free, a safe car seat for them and everything. But what happens after that? And that is where these TANF dollars could work so much better to helping them with affordable housing, which is longer than when you're 6 weeks old. So with that, I would yield back to Mr. Kildee.
I yield back.
Mr. Hearn is recognized to strike the last word.
Thank you, Mr. Chairman, and thank you, Ms. Fishbach, for introducing this important legislation. Pregnancy resource centers are an invaluable resource to help pregnant women and families in our communities, an issue that is very dear to me. I'm proud of the work that is being done in my home state to help women and families in need before and after birth. In 2022, Governor Kevin Stitt launched the Help Task Force in Oklahoma. This task force that's had several goals, but one primary objective was to help pregnant women and families at all stages. This task force was chaired by Julie Mercy, who operates a pregnancy resource center in Bartlesville, Oklahoma, because she knows firsthand the challenges facing pregnant women, whether the pregnancy was planned or not. As a result of the Help Task Force, Oklahoma recently launched the Pregnancy Navigators Program to integrate community health and home visiting models to provide new mothers and families with the support and care they need before, during, and after pregnancy. This proposed rule by the Biden administration, which suggests pregnancy resource centers would be ineligible for TANF funding, fails to recognize the good these centers do in their communities and misrepresents the purpose of these organizations. These centers provide free pregnancy tests, ultrasounds, counseling, parenting classes, housing, assistance, clothing, formula, diapers, and so much more. Prohibiting TANF funding for these services is not pro-woman nor pro-family. Pregnancy resource centers are a trusted resource in the community for women to turn to when they need help. Taking away a funding source for these centers threatens their ability to provide much-needed care. In Oklahoma, 41 out of 77 counties are considered a maternity desert, where access to obstetric care is essentially non-existent. In these counties, a pregnancy resource center may be the only option for women to get an ultrasound and other care and counseling they need early on in their pregnancy. Singling out a pregnancy resource center in this rule is just another example of this administration targeting and punishing organizations that don't adhere to their pro-abortion agenda. I'm proud to support this legislation to prevent the Biden administration from discriminating against pregnancy resource centers. I yield back.
Mr. Blumenauer is recognized to strike the last word.
Thank you, Mr. Chairman. I keep thinking that there ought to be a way to step back and be able to parse out what we're talking about and what we care about. You know, if we had actually standards, performance standards for these pregnancy resource centers to make sure that they are adhering to standard medical care, we've had examples where they aren't. And if we're going to open the floodgates to federal funding, there ought to be careful standards that are there. Opening those floodgates, sadly, is taking away resources that are badly needed in terms of TANF. That's not an unlimited source of money, and it shortchanges areas that most of us, I think, would agree upon. I am concerned that the attack on the emergency medical treatment and active labor legislation, which would undercut the ability of pregnant women and mothers to get the care that they need, is deeply troubling. We've seen examples where the woman in Texas, life was at risk. The prospect of doctors calling their lawyers while patients' lives are at risk ought to trouble us all. We don't need to be doing that. Where is the commitment to protect life when we have women whose lives are in jeopardy during pregnancy? American maternal health outcomes are terrible compared to international standards. They vary widely, and it is a tragedy when we do not have those health outcomes for American mothers. We all ought to agree on things that would make that better. The Dobbs decision, the attack on abortion rights, I think is unfortunate, and we're seeing negative consequences. Now, pretending a crisis pregnancy center provides actual health care, it's comprehensive health care, is misleading and misguided. As I say, it would be different if we had enforceable standards for what is being provided. And it shouldn't be taken diverting scarce federal dollars meant to help people who are in need. There are so many areas that members of this committee ought to be able to agree on, particularly advancing legislation on the child tax care credit, or paid family leave, or child care. These are policies that have broad support in this committee, in Congress generally, if people were able to vote on it, and certainly by the American public. I'm concerned that too many of these centers are anti-abortion clinics under a different guise. And advancing this legislation, I'm afraid, is an exercise in political theater, since we know it's not going to be enacted. And we do see time and time again, the American public supports reproductive rights. I hope we're not going to continue taking things that are out of step with what our constituents want and need. I'm sad that we are currently wasting time on culture wars when we could be debating these meaningful policies that we agree on. I mean, unfortunately, the majority couldn't even pass a rule to move ahead with the business of the week while the clock is ticking on things like the government shutdown. This is a disservice to the American people. I only have 51 weeks left in this august body, and I hope we can do a better job focusing on things that matter and that we can agree on. Thank you, and I yield back.
Mr. Feenstra is recognized to strike the last word.
Thank you, Chairman Smith, and I move to strike the last word. I want to thank Congresswoman Fischbach and Tenney for this policy. It's wonderful policy. I am a father of 4 children, a Christian. I believe God created every person for a reason, further his kingdom. But on saying that, I've toured my 36 counties, and I've toured pregnancy centers in Sioux Center and Storm Lake that have provided tremendous support for expecting mothers. This issue is fairly personal to me. I received my doctorate in healthcare administration approximately a year and a half ago with my very specific focus on maternal health outcomes, maternal care health outcomes. And I can tell you that we need support pregnancy centers in rural communities and not force them to close their doors. Currently, in Iowa, there are women traveling anywhere from 60 to 80 miles for maternal health care services. And this would be catastrophic. Obviously, these women would have to travel further. The biggest issue here in rural America, and I want everybody to listen to rural America. I know we have a lot of urban members in this room that don't have a clue what rural America is like. But infant and maternal mortality rates are dramatically going up in rural America because of our maternity health care deserts. And this bill will even create more deserts. This is serious stuff, people. This isn't just some political agenda. This is the life of a mother, a life of an infant that we're dealing with. And we're talking about it arbitrarily. We're talking about it subjectively. I had a member just subjectively say, well, this is what's happening. One lady said, let's talk about facts. Women and children are dying because of our lack of maternity care. Instead of delivering outstanding support services for our pregnant women, the Biden administration would rather steer tax dollars to urban centers and have no indifference for rural America. I'm proud to support this legislation. I stand with pregnancy centers uplifting expecting mothers to provide great quality care. Thank you, and I yield back.
Mr. Schneider is recognized.
Thank you, Mr. Chairman. I move to strike the last word. Thank you. Let me first associate myself with the remarks of my Democratic colleagues. As Mr. Thompson beautifully said, the Ways and Means Committee has a proud history of leading the Congress and the country in times of crisis, as well as at moments of importance. We should all be proud of the bipartisan legislation this committee drafted that became law in the 117th Congress. Less can be said, unfortunately, about the record so far in this 118th Congress. Last year was a record year for Congress doing almost nothing. This week we're not starting in a way that gives much hope for 2024 to be any better. There are important issues we should be talking about in this committee, in this room, not, as Mr. Blumenauer noted, wasting our time on culture wars. Turning to my friend, Mr. Feenster from Iowa, I share your outrage about the rising infant and maternal mortality rates in this country. We need to be doing something about it. It is a crisis. And I wish the crisis pregnancy centers were what my colleagues on the other side of the dais were saying they are. I'll concede that some do provide services and products, including diapers, blankets, and other items to mothers and families. But too often these centers are not what they say they are. They advertise as legitimate healthcare clinics when they are indeed not staffed by medical professionals, and importantly, not bound by HIPAA privacy protections. So I rise in opposition to this bill, which would allow so-called crisis pregnancy centers to continue misusing taxpayer dollars, even though they are not medically qualified and frequently deceive women at a time of great need. These so-called crisis pregnancy centers fail to provide services in line with any of the 4 statutory tenets of the Temporary Assistance for Needy Families, or TANF program. The primary goal of these sham centers is to use deceptive, coercive rather than supportive measures to dissuade women from assessing abortions. There is no reason why taxpayer-provided TANF money should go towards such scams. We know that many congressional Republicans want to impose a national abortion ban and seek to attack women's health care and take away women's free right to make the decisions about their own health and their health care in the privacy of conversations with their families and their doctors. That was clear long before today. Even so, as Mr. Thompson noted, I am baffled at the bizarre nature and timing of today's business. Instead of focusing on the urgent matters at hand, funding the government to avoid a shutdown, supporting our key allies, strengthening our national securities, Republicans on this committee are once again wasting our time in a performative effort to appease the pro-life movement. It's not lost on us that we are having this markup today to appease next week's March for Life rally, bringing to the Capitol anti-choice advocates to advocate for a nationwide abortion ban. So what should we be talking about today? In 8 days, on January 19th, the nation faces a wholly unnecessary partial government shutdown manufactured by House Republicans. 2 weeks later, Republicans are threatening to shut down the remainder of our government. Meanwhile, this committee should be talking about helping working families, mothers, and fathers with an enhanced child tax credit. We should be working to help American companies invest in research and development, creating quality jobs for American mothers and fathers. We should be marking up policies that build our economy and level the playing field for American workers, mothers and fathers hoping to compete in a global economy and provide for their family. Today's measure is a blatant distraction from the urgent matters at hand and not an effective use of this austere committee's time. This bill is not a serious effort and is an affront to the faithful stewardship we, the Ways and Means Committee, are supposed to exercise with taxpayers' hard-earned money. I urge my colleagues to oppose this measure, which would allow sham crisis centers to continue abusing federal money to deceive pregnant women while doing nothing to effectively accomplish the statutory goals of the Temporary Assistance for Needy Families program. And with that, I yield back.
Mr. Morse recognized.
Thank you, Chairman. I move to strike the last word. Most of my points have been made with regards to this topic. I'm gonna add just a few things, but I also want to just address a lot of the arguments kind of going back and forth today, and in particular, saying that we haven't done some good work on this committee. I resent that. It's been an absolute honor of mine to be working heavily on tax policy. I think we're doing an awesome job. We're trying to get to something, and I think we're all doing it in good faith. I think we've done some good work on trade. But also, as I continue to have to make a point, even to some of my own Republican colleagues, by us being in the majority, we keep bills like a $2 trillion American Rescue Plan that follow the months following 40 worst inflation we've had in 40 years. Like, we have to be responsible to keep that stuff at bay, and that's what we have been working on. And so when by having the majority on the Republican side, we've created a split government type of situation here where we're actually forcing good dialogue between us on matters that are the most important, and that's what this committee talks about is trade. Taxes, health policy that we just got done in the last month before we went to break. We are doing stuff, and I hope we can, sincerely recognize that. I don't want to be here talking about this topic either, and that's our point. Is that President Biden shouldn't have put this rule in place. That's the fundamental reason for us to be here, to talk about this, to debate this, to highlight this, and I really appreciate my colleagues to my right that I sit on the dais with, Ms. Tanny, Ms. Fishbach, for putting this legislation forward, because I've been to these pregnancy centers, okay, and they're not just trying to help someone decide to continue on with their pregnancy. They care about the longevity and the overall health and well-being of these women. When I went and visited one of these centers, I didn't know what to expect. I hadn't been to one before. And I got there, and they thanked me for signing on to a bill called the Care for Her Act that I did. I signed on to it I co-sponsored in my first term. And some of the things within that type of bill are some of the things that they're focused on. Job training, housing resources, clothing. I remember them saying, like, hey, if there's ever an event you could help come to, we're going to do a clothing drive and try to get all the necessary things that are needed. We have 4 kids. It's so expensive. I'm grateful that we have the resources to be able to get the bassinets and the cribs and all that type of stuff, these resources, the crib is used past six weeks. These types of centers go out to the community. They don't have a lot. They're not very wealthy organizations. The donors that they have do their best, but they don't provide just millions and millions of dollars to this. They need these resources. TANF is a sacred thing that we have to deal with in this committee, and to be able to say that TANF dollars can't go towards this effort is ridiculous, and we should not be here discussing this today because this should not have been a rule that President Biden put in place. And that's the point that I hope we can get across. These centers, yes, Republicans and Democrats are going to disagree. If this turns into a pro-choice versus a pro-life argument, we're going to vote. We're going to vote the way that everybody expects us to vote, and we're going to continue to communicate our talking points as the American public will expect. But if you actually look at what we're trying to do in this legislation, it's to say that folks are in need, women, families in need, can use these resources in TANF to go and take a part of the services that are more all-encompassing than they've been labeled today. And I'm proud to be willing to co-sponsor this and support this legislation today. And I hope that we can actually dig a little deeper and and move past our traditional talking points on either side of the aisle and look at what are we trying to support in our communities. And I yield back.
Mr. Byer.
Thank you, Mr. Chair. And I move to strike the last word. With a single decision by the Supreme Court, women lost a constitutional right they'd had for almost half a century. And now instead of women being able to make the best decision for themselves with the guidance of a doctor, they're at the mercy of their state. We just need to look at the example of Kate Cox in Texas and see an all-out war on women. And I fear that this legislation is part of that war. But I'm very grateful for my friend from Utah's perspective on this. I have not visited a crisis pregnancy center. Instead, my comments are based on the exposés and the investigations that talk about at least some of them lying to women, shaming them, pressuring them, all of them redirected to a forced birth. Mr. Chairman, I too have concerns about the merits of the TANF rulemaking. I know the governor of Missouri, a Republican, has communicated with the Administration for Children and Family about the inability to use TANF funds, perhaps under this, for high school dropout prevention. That we want to be able to use TANF funds to help women and children succeed. But instead of that, we're talking about restricting women's reproductive freedom and propping up the fraudulent forced birth centers. When women go to a crisis pregnancy center, you want to be able to make sure they're talking to medical professionals and even psychologists, psychiatrists, even spiritual things about what they need to go forward. If these centers actually meet TANF purposes, including helping low-income children live with their parents, reducing the use of government assistance, promoting family formation, my understanding is that they would still qualify. But instead, this seems to me that this is about forced birth. And if a vote for the bill today is a vote against women's reproductive choice, then I will be proud to vote no. And I yield back.
Mr. Evans.
Thank you, Mr. Chairman. I ask you to strike the last word. Mr. Chairman, as I've been listening and the conversation on both sides, it is good. I have a long history in elected office, dating all the way back to my days in the Pennsylvania legislature, of protecting and fighting for women's reproductive rights. So I share with you that it is unfortunate and quite frankly shameful that we are here today to discuss yet another Republican proposal that would further erode women's reproductive rights. It appears to me that there are numerous other things, as the ranking member has said, that this committee is focused on that we could be doing. This comes at a time when there's a laundry list of priorities this body should be addressing. For example, restoring the child tax credit so we can get child poverty down, pay for family leave, ensuring that our foster youth have adequate resources. So, in my view, Mr. Chairman, and as I have listened it is very important that we recognize that we have a lot of things to address. And we have the opportunity. Instead, we are voting on a bill that would divert money from poor children for anti-abortion centers. So it appears to me that we should move ahead and function together. I will continue to fight to enshrine abortion rights, to protect law and push laws against Republicans' attempts to dismantle vital protections. So I share with you, Mr. Chairman, that we should not miss this opportunity. And again, I thank you and I yield back.
Are there additional members that'd like to strike the last word? Seeing none, are there any amendments to the amendment in the nature of a substitute?
Mr. Chairman, I have an amendment at the desk.
Mr. Chairman, I reserve a point of order.
All right. A point of order has been reserved. The clerk will distribute the amendment, and I ask the gentle lady to suspend while the clerk distributes. The gentle lady is recognized for 5 minutes.
Thank you, Mr. Chairman. Becoming pregnant can impact Americans in different ways and with different supports. Some women want to get pregnant to start or grow their family. Some families struggle with infertility and need assistance to conceive. Some become pregnant in unintended and vulnerable circumstances or with serious risks to their health. Despite the different circumstances in which they become pregnant, all women should be able to receive fact-based, honest, comprehensive, and quality medical care. Unfortunately, that is not the reality for many women. Throughout the country, there are facilities that masquerade as legitimate reproductive health care centers, but in reality, their intended purpose is to discourage, limit, and shame women out of accessing abortion services. Let's be clear, these so-called crisis pregnancy centers are not health care. These fake clinics employ a variety of tactics to deliberately divert and mislead women into not accessing all available reproductive care. This is not only obstructive to the patient's access to essential health care, but can often cause severe psychological harm as well. These sham centers do not employ licensed healthcare professionals and are not subject to the same HIPAA privacy and security laws as legitimate medical facilities. They often target vulnerable, low-income communities and those who are expressly searching for abortion care. These deceptive facilities are causing harm to Americans while using taxpayer dollars. Unfortunately, there are at least 10 states that funnel temporary assistance for needing family dollars to counterfeit centers instead of providing the funds to real families in need. Temporary assistance for needy families, also known as TANF, was created by Congress to assist low-income families and help keep children out of poverty. Many states, like my home state of Washington, use TANF funds to provide direct cash benefits to low-income families and children. This helps families avoid economic instability and meet their basic needs. However, not all states provide TANF funds directly to needy families. And while some states use TANF dollars for beneficial purposes, such as funding workforce training programs or providing services for abused or neglected children, this is not always the case. Republicans on this committee seem more committed to funneling money to places that are not focused on helping families, instead of making sure that we are getting this money directly to families. Instead of actually helping children and families, House Republicans have been laser focused on taking away reproductive rights from Americans. So this amendment I am offering would ensure that no TANF dollars go to any of these deceptive centers. We should all be doing what we can to ensure that federal dollars are not used to fund dangerous and deceptive fake clinics. I urge my colleagues to vote yes on this amendment, and I yield back.
Does anyone else wish to speak on the amendment? Ms. Miller is recognized.
Thank you, Mr. Chairman. This charge that pregnancy resource centers misrepresent their services to expecting mothers and use unfair and questionable means to convince the mother to carry the baby to term, and that we must modify the definition of pregnancy centers to exclude pregnancy centers that are predatory towards women. I've been to these centers, and I know better. Democrats in the Biden administration are purposely targeting and misrepresenting pregnancy centers, and they're seeking to intimidate the states that do fund them. Pregnancy resource centers play a vital role to both mothers and fathers, empowering them in their decisions to choose life for their baby by providing realistic alternatives in stark contrast to services and clinics exclusively focused on abortion. Furthermore, many pregnancy centers have voluntarily signed on to the industry standards called Commitment of Care and Competence, created by Heartbeat International, that sets an ethical code in which they agree to adopt a transparent and honest service model. There is no deceit underlying pregnancy centers. They are just another option for women who choose to use their services, who are looking for an alternative to abortion. I encourage my colleagues to oppose this amendment. I yield back.
Ms. Chu is recognized.
I strongly support my colleague, Representative Delbenny's amendment, which would ensure that federal funds are not going to facilities that lie or misrepresent medical information to patients seeking care. I'd also like to take this opportunity to recognize Representative Delbenny for her work to combat the dangerous misinformation that crisis pregnancy centers peddle, and to let her know that she has my full support in those efforts. This is a common sense amendment. If facilities are masquerading as health centers but not providing accurate information, they should not receive federal dollars. The scourge of medically inaccurate information at these centers is prolific. For example, a woman in Massachusetts filed a lawsuit against one such center which had an unqualified staff member, in other words, not the appropriate medical professional, conduct her ultrasound, which resulted in them missing that she did not have a healthy pregnancy, but in fact had an ectopic pregnancy. Because of this misdiagnosis, she nearly died as a result of the ectopic pregnancy. There's also the issue of false advertising. My home state of California has filed a lawsuit against an anti-abortion group that operates 5 centers in the state for their false claims that these centers are able to offer services such as abortion reversal. Well, this claim is medically inaccurate and relies on studies that have been widely condemned by the medical community, including the American College of Obstetricians and Gynecologists and the New England Journal of Medicine. Not only that, this is downright dangerous to the lives of women. In the only study designed to rigorously test the effectiveness of the procedure known as abortion reversal, it was halted for safety reasons because 3 women in the study experienced severe hemorrhaging and had to be rushed to the hospital. If we must send federal dollars to these unlicensed, non-medical facilities, the least we can do is to ensure they are not providing medically inaccurate or misleading information. I support this amendment, and I yield back.
Are there additional? Ms. Fishbach.
Thank you, Mr. Chair. And I wanted to make sure that people understood what's really going on in the bill. Let's be clear about it. The Biden administration initiated this attack on the pregnancy care centers. They proposed the rule to take them out. What the Dems want, the Democrats want to do is, reduce options for women. And we want to make sure that women have all of the options open to them when they're facing pregnancy. And I'm just shocked at the rhetoric that has been thrown out there of sham, fake, and lie. And, it makes it obvious that most members on the other side have never visited a pregnancy care center, because if they did, they would see what I've seen. And what I've seen is caring individuals who care about the women and their children and want to support them in any way they can, a variety of things. And I know that many of our members have mentioned the kinds of help that women can get at those pregnancy care centers, but they want to support them in so many ways, and it is before and after birth. And I want to make sure that people understand, because they are throwing out a lot of words and accusing a lot of these pregnancy care centers of a lot of things that are just not accurate. Thank you, Mr. Chair. I yield back.
Does anyone else wish to speak on the amendment? Ms. Sanchez.
Yeah, I wholeheartedly support my colleague Delbeni's amendment. And I keep hearing, I've been to crisis pregnancy center and they're great and they're doing all these great things, and how dare we say that they're lying and they're misleading. A 2006 congressional investigation found that 87% of these centers provided false or misleading information about abortion. We're not alleging it without facts to back it up. And the women that walk through those doors, we want them. Dems don't want to limit choice. We want them to have choices, but we want their choices to be based on fact and science, not on somebody pushing a certain perspective or agenda. We want them to have all the information that an impartial medical professional would provide to a patient. That's all we're asking for. You guys should want that too. What are you afraid of? If these centers provide neutral, fact and science-based information, they will be eligible for the funding. But if they're lying, if they're misrepresenting, if they're coercing or shaming women into continuing with a pregnancy that may not be in the best interest of the mother because it either impacts her health or could cause her death, or certainly would impact her family, that woman should have the choice free of coercion, free of misrepresentation. It should be provided by a licensed medical professional who can sit down and have an honest conversation about what is in that woman's best interest. That's all we're saying here. We're not saying they shouldn't have a choice. We're saying they should have a fact and science-based choice, not one from somebody who's pushing a very obvious agenda. And perhaps they do provide some services for women, but that doesn't mean that they can't also be doing that under false pretenses. If you guys want women to have true, impartial information to make the best choice that is right for that woman, you guys would not be afraid of this amendment, and you would be supporting it as I do. And with that, I yield back.
Mr. Kelly is recognized.
Mr. Chairman, I yield my time to Ms. Fishbaugh.
Thank you, Mr. Kelly. I appreciate the opportunity to just, and I'm very curious because the 2006 study has been thrown out there a couple of times. And just to put that in perspective, that is 18 years old. So if we don't have any more up-to-date, accurate information, I would think that the information that I have from being inside of pregnancy care centers very recently, many of them, there are many in my districts, and I think that there was a couple of people on this side of the aisle that said they've been in them fairly recently. I think that that would be a much more accurate depiction of what's going on and the kind of loving and caring atmosphere that is happening in these pregnancy care centers, and the support that women and their children are getting. They can use all the words they want, sham, fake, lie, they can do that, but it doesn't stop the fact that there are There is love and support and help going on in these crisis or pregnancy care centers. And I oppose the amendment. I want to make sure that they can continue their important work of supporting women, and it saddens me that, that the other side has decided that to cut this kind of support off for women. Thank you, and I yield back.
Are there additional members to speak on the amendment? Seeing none, the question is on agreeing to the amendment offered by Ms. Del Bene. Okay, I'll recognize you, but I did not hear anything, and Mr. Neal didn't tell me anything, so.
I yield my time to Ms. Sanchez.
I want to thank my colleague, Mr. Higgins, for yielding time. Okay, perhaps 2006 isn't the most recent study, but then I would think that maybe this committee should commission a study, have a new study before trying to change or implement this legislation that we're talking about. Why don't we have facts before moving forward? And unless my colleagues on the other side of the aisle can say unequivocally that not one of these centers uses coercive methods or misinformation or disinformation, do not undercut the fact that this study proves that there was. Maybe there isn't anymore, but perhaps a study would be a more fruitful approach to this than the legislation that we are debating today. And with that, I will yield back to my colleague, Mr. Higgins.
Are there additional individuals wishing to speak on the amendment? Seeing none, does the gentleman withdraw his reservation?
I do.
The gentleman withdraws his reservation. The question is on agreeing to the amendment offered by Ms. Del Bene. All those in favor signify by saying aye. Aye. Those opposed say no. No. In the opinion of the chair, the noes have it.
Roll call, please.
The clerk will call the roll.
Mr. Buchanan?
No.
Mr. Buchanan? No. Mr. Smith of Nebraska? Mr. Smith of Nebraska? No. Mr. Kelly? Mr. Kelly? No. Mr. Schweikert? Mr. LaHood? Mr. LaHood? No. Dr. Winstrup? Mr. Arrington? Dr. Ferguson? Mr. Estes? Mr. Estes? No. Mr. Smucker? Mr. Smucker? No. Mr. Hearn?
No.
Mr. Hearn? No. Mrs. Miller?
No.
Mrs. Miller? No. Dr. Murphy? Dr. Murphy? No. Mr. Kustoff? Mr. Kustoff? No. Mr. Fitzpatrick? Mr. Stubbe? Ms. Tinney? Ms. Tinney? No. Mrs. Fishbach? Mrs. Fishbach? No. Mr. Moore? Mr. Moore? No. Mrs. Steele? Mrs. Steele? No. Ms. Van Dyne? Ms. Van Dyne? No. Mr. Feenstra? Mr. Feenstra? No. Ms. Maliotakis? Ms. Maliotakis? No. Mr. Carey? Mr. Carey? No. Mr. Neal? Mr. Neal? Yes. Mr. Doggett? Mr. Doggett? Yes. Mr. Thompson? Mr. Thompson? Yes. Mr. Larson? Mr. Larson? Yes. Mr. Blumenauer? Mr. Blumenauer? Yes. Mr. Peskrell? Mr. Davis? Mr. Davis? Yes. Ms. Sanchez? Ms. Sanchez? Yes. Mr. Higgins? Mr. Higgins? Yes. Ms. Sewell? Ms. Del Bene? Ms. Del Bene? Yes. Ms. Chu? Ms. Chu? Yes. Ms. Moore? Ms. Moore? Yes. Mr. Kildee? Mr. Kildee? Yes. Mr. Byer? Mr. Byer? Yes. Mr. Evans? Mr. Evans? Yes. Mr. Schneider? Mr. Schneider? Yes. Mr. Panetta? Mr. Panetta? Yes. Mr. Schweikert. Mr. Schweikert, no. Dr. Winstrup. Dr. Winstrup, no. Mr. Arrington. Dr. Ferguson. Dr. Ferguson, no. Mr. Fitzpatrick. Mr. Stubbe. Mr. Pascrell. Mr. Pascrell, yes. Ms. Sewell. Chairman Smith?
No.
Chairman Smith, no.
How is Mr. Arrington recorded?
Mr. Arrington is not recorded. Mr. Arrington, no.
The clerk will report the vote.
The ayes are 17, the noes are 23.
There being 17 ayes and 23 noes, the amendment is not agreed to. Are there additional amendments? Ms. Chu is recognized.
Mr. Chairman, I reserve a point of order.
Point of order has been reserved. The clerk will distribute the amendments, and I ask the gentle lady to suspend while the clerk distributes. The gentle lady can proceed.
Mr. Chair, my amendment is simple. It would prevent any more federal dollars from going to so-called crisis pregnancy centers until a certification by the Secretary of HHS that diverting women who seek abortion care to these centers has no negative impact on their health or future. If my colleagues on the other side of the aisle are so certain that crisis pregnancy centers benefit women seeking health care, this should be easy for them to support. Since the disastrous Dobbs decision at the Supreme Court, we've heard countless stories of the horrific impact on women's health that being denied abortion care can have. Like Anya Cook of Florida, who was devastated when her water broke because her fetus was viable. Anya had gone through rounds of IVF and had 17 miscarriages, so she was devastated that she was losing her baby. But even though she went to the emergency room, she was told she was not sick enough to receive abortion care, which is the standard medical practice in cases such as this. Instead of getting care from the doctors who had the ability to treat her, Anya was sent home. She miscarried the next day, but she was losing too much blood. She was once again rushed to the hospital where she deteriorated. She lost what doctors described as a life-threatening amount of blood. She was put on a ventilator that was breathing for her 100%. The hemorrhaging continued. Her placenta had embedded itself in the wall of her uterus, causing the hemorrhage. If she had been allowed to be treated at the hospital initially, the doctor would have been able to treat this condition and Anya would not have been so close to death. These are the real-life medical risks that occur when women are denied abortion care. But they are not the only consequences. A study done by the University of California, San Francisco, found that the consequences of being denied an abortion when you seek one are long-lasting. The study found that women who were turned away from abortion care were more likely to not have enough money to cover basic living expenses like food, housing, and transportation. They experienced an increase in household poverty that lasted 4 years longer than those who received an abortion. And the children that these women already had at the time saw worse child development if their mother was denied an abortion compared to children whose mother received one. And finally, what is at the heart of the matter is health care. Women who were denied an abortion reported more life-threatening complications, and 2 women in the study died following the delivery of their child. None died from an abortion. Again, if my colleagues are certain that crisis pregnancy centers actually result in better care and future for women, this should be an easy amendment to support. I urge all my colleagues to vote yes.
Ms. Tinney is recognized.
Thank you, Mr. Chairman. And I'm not sure where all this hyperbole is coming from. I have the good fortune in my very large district in upstate New York, where late-term abortion is the law of the state, to actually have been to numerous crisis pregnancy centers, to support CareNet, which is a statewide group that helps so much with our pregnancy centers. I'm repeatedly, every time I go to an event or attend one of these centers, I'm so impressed with the quality of the people that are serving there, how kind and generous they are, and how grateful women and families are to go to these centers and to meet families and to meet how excited they are about their children who were given the opportunity at life. Now, this is a choice for women and families. This is a choice to be able to go to these pregnancy centers and to actually have their children. And they go beyond just offering counseling and care during the pregnancy. I've met with so many of them. I've become friends with them. I've met them later in life. One of the women who chose to keep her baby and to go through the process with her baby presented her 18-year-old son, who was the starter on the football team in our local region, who was the star. He was the guy. He got a scholarship to a college. He was an amazing 6'5", gorgeous young man, and we followed him throughout his life. It's an incredible experience, and all of these people have provided an extended family to these people. I just don't. This characterization is just beyond the pale. I urge everyone to come to one of these crisis pregnancy centers, and not only just outside my district in upstate New York. Compass Care was bombed by Jane's Revenge. We had to come up with money all through private donations to try to restore and rebuild the Compass Care Center. The Reverend Hardin, who runs it, is an amazing guy. He's out there helping. These people don't just get people through the pregnancy. They don't have some mission just to prevent abortion. They have a mission to promote life. And that's what they're doing, and they're staying with these families throughout their lifetime to help these women and their families stay together and to raise the children. And I just think it's a shame that the Democrats on the other side of the aisle and the Biden administration are purposely choosing to limit a woman's choice. All they talk about is choice, but a woman should purposely want to raise this child if she can, and a pregnancy resource center such as Compass Care, CareNet, other agencies around the country are allowing this to happen. And the fact that they are so opposed to choice is astounding. And I have seen nothing but wonderful, just wonderful experiences. And the story told by my colleague, Dr. Wenstrup, about his experience with his own wife is what I see every day with these crisis pregnancy centers. They are doing everything they can to give women a choice, to give these people and their families an opportunity. And I just don't understand. I think everyone should try to go to one before you characterize them in the way that's being characterized. I just urge all my colleagues to oppose this amendment, and I yield.
Ms. Moore is recognized.
Thank you so much, Mr. Chairman. And I too want to add my voice of support for Ms. Chu's amendment. I think it's very thoughtful to make sure that the Secretary of Health and Human Services determines that there are no medical or economic effects on women seeking abortion care who are directed to these pregnancy counseling centers. It seems to me that just the example that Ms. Chu gave of the woman in Texas who was told that she needed to go into a sepsis before she could have an abortion, told that by medical professionals, it's hard to believe that she would have gone to one of these pregnancy counseling centers where there are no medical professionals at all and gotten any better advice than that. I just want to say this with the remainder of my time. I talked about my extensive experience as a mother, grandmother, great-grandmother, someone who has supported people who have given birth right there holding their hands while they gave birth, holding their hands while they've had an abortion. And I just want to say that I too have had an abortion. And I just want to say this. I heard my dear colleague, Ms. City, talk about people having children if they can. And I think can is an operative word. And that is different for different women. Miss Ayana in Texas couldn't have a child. She had had several miscarriages and her health was in jeopardy. Even though she wanted a child, she couldn't have a child. I think there are other people who can't have a child because they don't have the capacity to have the child. They have disabilities, they have illnesses. I'm thinking of the 10-year-old child in Ohio who was raped. She became pregnant because she was raped. That is somebody that I would question whether or not they had the capacity, physically, emotionally, and every other way to have a child. One of the real complaints that I have about Hobby Lobby, who made itself a plaintiff in the case against providing birth control for women, is that parenting is not a hobby. And there's a long time between the day you become pregnant and the day your child becomes the star of the football team. There's a whole lot of stuff that goes on between that moment and the time that you can proudly say that you've been successful in rearing that child. And these pregnancy centers don't contribute to those great outcomes that we all want for children. Women have to have the capacity, which is the reason that they need to have choice, because they need to discern immediately whether they have the capacity, whether or not they have the capacity. And I have 3 children that I love. You know, one of them says that they feel like they hit the jackpot when they got me for a mother. I don't know whether that's true or not, but that's his opinion. But what I can say is at the time that I had an abortion, I did not have the capacity. And thank God that I had the right to make that determination. And with that, I would yield back.
Mr. Winstrup is recognized.
Ms. Moore, I would be glad to introduce you through a video that the young woman made. And I think you would come away agreeing she has full capacity, had full capacity, probably more capacity than most people in the United States government today. And I'll just leave it at that. But I want to talk about some of the dishonesty, really, that's coming from the voices here today. These centers provide honest information about the services that they offer. They're vital services that meet critical needs, including ultrasounds and STD, STI testing. They do not hold themselves out to provide all forms of health care. It's transparent, it's honest, and it's a choice someone makes to go there. According to a recent PRC report surveying 2,750 U.S. centers, this is from the Charlotte Lozier Institute in 2022, there were 4,779 licensed medical staff, 5,396 licensed medical volunteers, 517,557 RDMS hours performing ultrasounds, 104,559 RN hours meeting with STD, STI test clients. Facts are stubborn things. Please be honest in our conversation here. I yield back.
Does anyone else wish to speak on the amendment? Seeing none, does the gentleman continue to reserve his point of order? The gentleman withdraws his reservation. The question is on agreeing to the amendment offered by Ms. Chu. The clerk will call the roll.
Mr. Buchanan?
No.
Mr. Buchanan, no. Mr. Smith of Nebraska? Mr. Smith of Nebraska, no. Mr. Kelly? Mr. Kelly, no. Mr. Schweikert? Mr. LaHood? Mr. LaHood, no. Dr. Winstrup? Dr. Winstrup, no. Mr. Arrington? Dr. Ferguson? Dr. Ferguson, no. Mr. Estes? Mr. Smucker? Mr. Smucker, no. Mr. Hearn? Mr. Hearn, no. Mrs. Miller? Dr. Murphy? Mr. Kustoff? Mr. Kustoff, no. Mr. Fitzpatrick? Mr. Stubbe? Ms. Tinney? Ms. Tinney, no. Mrs. Fishbach? Mrs. Fishbach, no. Mr. Moore? Mrs. Steele? Mrs. Steele, no. Ms. Van Dyne? Ms. Van Dyne, no. Mr. Feenstra? Mr. Feenstra, no. Ms. Maliotakis? Ms. Maliotakis, no. Mr. Carey? Mr. Carey, no. Mr. Neal? Mr. Neal, yes. Mr. Doggett? Mr. Thompson? Mr. Thompson, yes. Mr. Larson? Mr. Larson, yes. Mr. Blumenauer? Mr. Blumenauer, yes. Mr. Pascrell? Mr. Pascrell, yes. Mr. Davis? Mr. Davis, yes. Ms. Sanchez? Ms. Sanchez, yes. Mr. Higgins? Mr. Higgins, yes. Ms. Sewell? Ms. Delbene? Ms. Delbene, yes. Ms. Chu? Ms. Chu, yes. Ms. Moore? Ms. Moore, yes. Mr. Kildee? Mr. Kildee, yes. Mr. Byer? Mr. Byer, yes. Mr. Evans? Mr. Evans, yes. Mr. Schneider? Mr. Schneider, yes. Mr. Panetta? Mr. Panetta, yes. Mr. Schweikert? Mr. Schweikert, no. Mr. Arrington? Mr. Arrington, no. Mr. Estes? Mr. Estes, no. Mrs. Miller? Mrs. Miller, no. Dr. Murphy? Mr. Fitzpatrick? Mr. Stubbe? Mr. Moore? Mr. Moore, no. Mr. Doggett? Mr. Doggett, yes. Ms. Sewell? Chairman Smith?
No.
Chairman Smith, no.
Clerk will report the vote.
The ayes are 17, the noes are 22.
There being 17 ayes and 22 noes, the amendment is not agreed to. Are there additional amendments? Ms. Sanchez.
Mr. Chairman, I have an amendment at the desk.
Mr. Chairman,
Mr. Kelly.
I reserve a point of order.
All right. A point of order has been reserved. The clerk will distribute the amendment, and I ask the gentle lady to suspend while the clerk distributes. Ms. Sanchez is recognized.
Thank you, Mr. Chairman. The legislation before us today redirects funds from needy families to instead support crisis pregnancy centers that are actively harmful. These facilities use false and misleading information to dissuade people from accessing abortions or contraception. They do not provide impartial care. In a major study of 607 anti-abortion centers across 9 states, the Alliance State Advocates for Women's Rights and Gender Equality found that almost 2/3 of anti-abortion centers promoted patently false and/or biased medical claims about pregnancy, abortion, contraception, and reproductive health care providers. Additionally, fewer than half of these centers reported having a licensed medical professional on staff. Anti-abortion counseling centers are widely considered to be unethical by healthcare professionals and the American Medical Association. In fact, the American College of Obstetricians and Gynecologists issued a brief entitled Crisis Pregnancy Centers. People seeking reproductive health care must have access to comprehensive, evidence-based, non-judgmental health care and information from qualified professionals, regardless of whether they decide to continue a pregnancy or to seek abortion care. And I would ask unanimous consent to enter that into the record, as well as the 2006 congressional investigation entitled False and Misleading Health Information Provided by Federally Funded Pregnancy Resource Centers. I would ask unanimous consent
Without
to
objection.
enter those into the record. While 9 states currently divert TANF funds to actively support these dangerous anti-abortion centers, we also know that state offices are actively referring individuals to these centers when they reach out for help. Now, my colleagues on the other side of the aisle have said these women seek out these centers voluntarily. Well, not when they're being referred there by state agencies where they go to seek help. TANF, the aim of TANF is to help families with children, not families that might have children. When parents reach out to a state TANF program, they should feel free to do so without judgment or fear of coercion to a far-right ideology. My amendment requires the Secretary of Health and Human Services to certify that no TANF funds or resources are used to make these harmful and coercive referrals to crisis pregnancy centers. Individuals who come to these state offices for much-needed assistance should not be sent to facilities that use false information and emotional manipulation to deter women from seeking legitimate professional reproductive health care. My Republican colleagues are intent upon using federal dollars intended to help families to instead pursue their own extreme anti-choice agenda. They are very obviously out of step with what the vast majority of women in this country want and need, which is access to the full range of reproductive health care, whether that's from conception to abortion or anything else. My amendment ensures that families who apply for benefits to help support their basic needs will not be redirected to these deceptive and harmful facilities. By voting for my amendment, my colleagues can show that their priority is supporting American families and not coercing our most vulnerable populations with misleading and deceptive information. So I urge my colleagues to vote yes on this amendment. Again, my colleagues have said these women go into these centers voluntarily, not when they're referred there by state staff. This should not be occurring until we can certify that these crisis pregnancy centers are providing that neutral, unbiased, unjudgmental, scientific fact that allows a woman to make a truly informed and independent choice about whether or not to continue with a pregnancy. And with that, I yield back the balance of my time.
Ms. Van Dyne is recognized.
Thank you very much, Mr. Chairman. You know, we've heard a lot about wanting to do studies on harm. The fact is that nearly 100% of abortions actually lead to death of a child. Not to mention, we know for a fact that there's been hundreds of women who have died as a result of botched abortions. However, that number is grossly underrepresented, as states with some of the highest abortion rates, for example, California, they don't even report those numbers. But let's see what some of the centers that my colleagues on the left actually support. For example, Planned Parenthood. They argue that we need to fund Planned Parenthood because it gives women resources to have actually health care. Well, the fact is that total services are down from Planned Parenthood by 17%. With changing practice guidelines, total cancer screening and prevention services have dropped by 71%, including declines of 74% for breast exams and 70% for Pap tests. Prenatal services are down 85%, and contraceptive services are down 97%. The fact is that what Planned Parenthood does provide is 97.2% of their services are abortions. So when we think about like where are women going to get their actual health care, we are taking an opportunity and a resource away from them. On the flip side, from what Planned Parenthood offers, we've got pregnancy centers and what they offer. 82% of them have access to ultrasound. Parenting and education classes make up almost 88%. 72% after abortion support and recovery. So these are women who've had abortions who can then seek help from these centers. They have maternal items, 90%. STD screenings at 36%. STD screenings of treatment at 28%. Lactation and breastfeeding consultant. For 27% of the centers have those. Fertility awareness methods, 11.45%. And the list goes on and on of the services that are provided by these centers. So the idea that we are somehow not getting health care to women, you want to take this resource away from them. And I've heard from my colleagues that, well, these resources really aren't voluntary, and that people who go there feel pressured. They feel like they're forced to do this. The fact is, PRCs have some of the highest satisfaction rates around. Of the 16 million client sessions that took place in 2022, 97% of clients self-reported a positive experience. These numbers speak to why 91% of Americans support pregnancy centers. These women who voluntarily seek help are getting that. These women don't feel deceived. They don't feel forced. And then we hear that, oh, well, they don't have any access to real healthcare professionals. PRCs have a high standard of care. And most PRCs affiliate with a national network, most prominent being CareNet, Heartbeat International, and National Institute of Family and Life Advocates. So if we're going to talk about this issue, at least be honest. Thank you, Chairman, and I yield back.
Ms. Chu is recognized.
I support Representative Sanchez's amendment to ensure that TANF funding is not used to refer women to these crisis pregnancy centers. We know that the only purpose of these centers is to turn women away from abortion. And what happens when they are turned away from abortion? Well, there is an actual study, a very recent study that was released the year before last, 2022. And it was done by the University of California at San Francisco. And in fact, it's called the Turnaway Study. And it looked at 1,000 people seeking abortions. And it looked at what happened to them. And let me tell you what their main findings are. One, the people that were denied abortion suffered from more economic hardship. They were 3 times more likely to report being unable to afford basic living expenses. Secondly, the people denied abortion were more likely to stay in contact with a violent partner and were more likely to raise the resulting child alone without family or partner support. 3, the resulting children were more likely to live in poverty. 4, the people denied an abortion reported more life-threatening complications from the end of pregnancy, including eclampsia and infections. 5, those denied abortion who gave birth reported worse health and greater chronic pain than those who were able to terminate their pregnancy. 6, more than 95% of people who chose to have abortions reported that it was the right decision for them 5 years later. 7, that 95% of people report that having the abortion was the right decision for them over the years after the procedure. And finally, 8, those who sought and received an abortion were more financially stable, set more ambitious life goals, and raised children under more stable conditions. Clearly, there is a very negative effect to those who are turned away from abortion, and that's why I urge my colleagues to vote yes on Representative Sanchez's amendment.
Mr. Winstrup is recognized.
Yeah, thank you. As a medical provider, I want to say medical providers make referrals all the time. And they make the referrals in what they think, in their judgment, is in the best interest of the patient. The patient decides if they want to follow up on that referral. Nobody's brought in handcuffs and forced to be there because someone made a referral. The real world doesn't work that way, nor should it. I mean, I will say we did see patients that were sometimes in handcuffs and orange suits and with an escort. But that patient even had the choice of whether they wanted to go to the doctor or not. And I yield back.
Does anyone else wish to speak on the amendment? Seeing none, the question is on agreeing to the amendment offered by Ms. Sanchez. The clerk will call the roll.
Mr. Buchanan?
No.
Mr. Buchanan, no. Mr. Smith of Nebraska? Mr. Kelly? Mr. Kelly, no. Mr. Schweikert? Mr. LaHood? Mr. LaHood, no. Dr. Winstrup? Dr. Winstrup, no. Mr. Arrington? Dr. Ferguson? Dr. Ferguson, no. Mr. Estes? Mr. Estes, no. Mr. Smucker? Mr. Smucker, no. Mr. Hearn? Mr. Hearn, no. Mrs. Miller? Mrs. Miller, no. Dr. Murphy? Mr. Kustoff? Mr. Fitzpatrick? Mr. Stubbe? Ms. Tinney? Ms. Tinney, no. Mrs. Fishbach? Mrs. Fishbach, no. Mr. Moore. Mrs. Steele. Mrs. Steele, no. Ms. Van Dyne. Ms. Van Dyne, no. Mr. Feenstra. Mr. Feenstra, no. Ms. Maliotakis. Ms. Maliotakis, no. Mr. Carey. Mr. Carey, no. Mr. Neal. Mr. Neal, yes. Mr. Doggett. Mr. Doggett, yes. Mr. Thompson. Mr. Thompson, yes. Mr. Larson. Mr. Larson, yes. Mr. Blumenauer. Mr. Blumenauer, yes. Mr. Peskrell. Mr. Peskrell, yes. Mr. Davis. Mr. Davis, yes. Ms. Sanchez. Ms. Sanchez, yes. Mr. Higgins. Mr. Higgins, yes. Ms. Sewell. Ms. Sewell, yes. Ms. Del Bene. Ms. Del Bene, yes. Ms. Chu. Ms. Chu, yes. Ms. Moore. Ms. Moore, yes. Mr. Kildee. Mr. Kildee, yes. Mr. Byer. Mr. Byer, yes. Mr. Evans. Mr. Evans, yes. Mr. Schneider. Mr. Schneider, yes. Mr. Panetta. Mr. Panetta, yes. Mr. Smith of Nebraska. Mr. Smith of Nebraska, no. Mr. Schweikert. Mr. Schweikert, no. Mr. Arrington. Mr. Arrington, no. Dr. Murphy. Mr. Kustoff. Mr. Kustoff, no. Mr. Fitzpatrick. Mr. Stubbe. Mr. Moore. Mr. Moore, no. Chairman Smith?
No.
Chairman Smith, no.
Clerk will report the vote.
The ayes are 18, the noes are 22.
There being 18 ayes and 22 noes, the amendment is not agreed to. Are there additional amendments? Ms. Moore is recognized for an amendment.
Mr. Chairman, I have a point of order. Reserve a point of order.
A point of order has been reserved. The clerk will distribute the amendment, and I ask the gentle lady to suspend while the clerk distributes. The gentlelady is recognized for 5 minutes.
Thank you so very, very much, Mr. Chairman. And I was hoping that Ms. Van Dyne would be in the room so that I could really say to her that one of the things that concerned me about her remarks was, you know, the notion that somehow I thought that people on the other side did not care about kids. I think we all care about children. I did go and look up the meaning of the word care in the dictionary. And it's interesting, there's more than one definition for care. And one definition of care is, you know, is a state of mind where you have good thoughts and prayers and you care about people. And the other thing is is making provisions for people. And that is what this amendment is about. You know, the horrific Dobbs decision, we were reassured that, that even though the Supreme Court had eviscerated, repealed Roe v. Wade, that women would be able to get necessary health care when they need it. And of course, you know, I don't have enough time to go through all of the casework, but we all know at least 2 women in Texas, one who had to develop sepsis before she could get assistance, another who had to flee the state, and I'm thinking of that 10-year-old child in Ohio who was raped and had to flee the state in order to get an abortion. There has been, we've waxed on about women who are African American women and how at risk they are, about women in rural areas. And so this is not just a few women. These are millions of women who are at risk of not being able to get the health care that they want, because we are implementing a policy of forced birth. And I say, if you're going to force people to have children, I want you to care for them. That by definition, in order to qualify for TANF, the monies that we're talking about here, you have to be below the poverty level. And so this bill really says that the Department of Health and Human Services has to, before this provision of diverting these monies from TANF for these pregnancy help centers, before we divert those funds, that we are assured that we care for those low-income women who have been forced to bear children, that we provide them with the housing that they need, that we provide them with the child care that we need, that we provide them and make provisions, that we don't just give our thoughts and prayers and send them off after 6 weeks with, you know, with a couple dozen diapers, that we actually take care of them since their mothers may have made other choices. Another thing, we've heard many of our colleagues say that these women come into these centers voluntarily. No one makes them come into these centers. But given the lay of the land today, when a woman is having a crisis pregnancy, say they live in Texas, for example, they're having a crisis pregnancy. And as we are forcing abortion clinics to close down, as we are seeking a national ban on abortions, as we are forcing women to be near death and still unable to get an abortion, you know, these pregnancy centers may become a vital role in giving women information and counseling pursuant to their inability to terminate a pregnancy if that's what they want. And so I think that this provision enabling these pregnancy centers to thrive would be just fine as long as we care for those women who have been forced into childbirth because of their poverty. And with that, I would yield back my 10 seconds.
Is there any discussion on the amendment? I have been wanting to recognize the gentleman from Georgia, Mr. Ferguson, Dr. Ferguson, all day. Since our last hearing, you announced that you're going to leave us, and I want to tell you we're going to miss your choice of words. We're going to miss your leadership as the chairman of the Social Security Subcommittee. But we're going to miss your friendship in this chamber. Mr. Ferguson.
Thank you for those kind words, and you may regret saying you're going to miss my words after my response. In all seriousness, I listened, Mr. Chairman, to my colleague from Wisconsin feign on about life and protecting folks that are below the poverty level and worried about the damage that can come. And yet I've watched my colleagues on the other side of the aisle completely ignore a humanitarian crisis of epic proportion at our southern border. When we talk about the number of lives that are being lost or argued about here, whether it's the unborn or the mother's life, we are missing the big picture here that literally tens of thousands of our fellow Americans are dying because of fentanyl overdoses, driven primarily by the cartels moving fentanyl across a wide open southern border. When we talk about preserving dollars for our most needy, we have almost 12 million people that have come across this border, or will be by the end of this year. 12 million. Think about that for just a minute. That's almost more than the state of Ohio, maybe more than the state of Ohio. And we are not even talking about on this committee, which has jurisdiction over so many social safety net programs, how in the world you're going to pay for that. Because these folks are not just going to come here and completely assimilate overnight into America. That takes years to do. There's going to be pressure on our school systems, pressure on our healthcare systems, pressure across the board. And you talk about diluting resources. I just wish that we would be more intellectually honest in what we're doing. You literally have, you're talking about, and every life is important, a small number of our fellow Americans, but you seem to be ignoring the tens of thousands of deaths due to fentanyl, the deletion of resources because of we have so many people that have come across this border illegally that we don't know how we're going to pay for those folks when they show up. 12 million people, when they show up in our hospitals, when they show up in our schools, when they apply for assistance with food, with assistance for housing. Think about what is happening in New York right now. We are kicking school children out of the classroom to house people that are here illegally. If I'm a parent in New York, I'm going to lose my mind over that. We have big city mayors across the country that are screaming for more federal resources, money that we don't have that we're going to have to borrow. And yet, we aren't protecting the very people that are already in this country that are American citizens. So I get a little bit tired of all of this outrage on this particular issue when we are missing the big picture about fentanyl overdoses and about the cost of illegal immigration and how it is going to continue to bankrupt this country because the funds simply are not here. We should be fixing Social Security. We should be fixing Medicare. We should be having pro-growth policies here. At the end of the day, we're fighting over a nit on a gnat, and it's about doing the right thing for this country. Mr. Chairman, I hope I didn't disappoint you with the use of my words, and I appreciate your kind comments, and I yield back the balance of my time.
Never disappoint, Dr. Ferguson. Additional members wish to speak on the amendment? Seeing none, the question is on agreeing to the amendment offered by Ms. Moore. The clerk will call the roll.
Mr. Buchanan?
No.
Mr. Buchanan, no. Mr. Smith of Nebraska? Mr. Kelly? Mr. Kelly, no. Mr. Schweikert? Mr. LaHood? Dr. Winstrup? Dr. Winstrup, no. Mr. Arrington? Dr. Ferguson?
No.
Dr. Ferguson, no. Mr. Estes? Mr. Estes, no. Mr. Smucker? Mr. Smucker, no. Mr. Hearn? Mr. Hearn, no. Mrs. Miller? Mrs. Miller, no. Dr. Murphy? Dr. Murphy, no. Mr. Kustoff? Mr. Kustoff, no. Mr. Fitzpatrick? Mr. Stubbe? Ms. Tinney? Ms. Tinney, no. Mrs. Fishbach? Mrs. Fishbach, no. Mr. Moore? Mr. Moore, no. Mrs. Steele. Mrs. Steele, no. Ms. Van Dyne. Ms. Van Dyne, no. Mr. Feenstra. Mr. Feenstra, no. Ms. Maliotakis. Ms. Maliotakis, no. Mr. Carey. Mr. Carey, no. Mr. Neal. Mr. Neal, yes. Mr. Doggett. Mr. Doggett, yes. Mr. Thompson. Mr. Thompson, yes. Mr. Larson. Mr. Larson, yes. Mr. Blumenauer. Mr. Blumenauer, yes. Mr. Pascrell. Mr. Pascrell, yes. Mr. Davis. Mr. Davis, yes. Ms. Sanchez. Ms. Sanchez, yes. Mr. Higgins. Mr. Higgins, yes. Ms. Sewell. Ms. Sewell, yes. Ms. Delbene. Ms. Delbene, yes. Ms. Chu. Ms. Chu, yes. Ms. Moore. Ms. Moore, yes. Mr. Kildee. Mr. Kildee, yes. Mr. Byer. Mr. Byer, yes. Mr. Evans. Mr. Evans, yes. Mr. Schneider. Mr. Schneider, yes. Mr. Panetta. Mr. Panetta, yes. Mr. Smith of Nebraska. Mr. Smith of Nebraska, no. Mr. Schweikert. Mr. Schweikert, no. Mr. LaHood. Mr. LaHood, no. Mr. Arrington. Mr. Arrington, no. Mr. Fitzpatrick. Mr. Stubbe. Chairman Smith.
No.
Chairman Smith, no.
Clerk, report the vote.
The ayes are 18, the noes are 23.
There being 18 ayes and 23 noes, the amendment is not agreed to. Are there additional amendments? Mr. Davis.
Mr. Chairman, I reserve a point of order.
A point of order has been reserved. The clerk will distribute the amendment, and I ask the gentleman to suspend while the clerk distributes. The gentleman is recognized for 5 minutes.
Thank you, Mr. Chairman. This amendment is about good governance. Before Congress declares that crisis pregnancy centers do not need to meet the purpose of TANF law, at a minimum, we should know how much federal money is being diverted from helping poor children to limit women's reproductive rights. My constituents demand their own reproductive health decision-making. However, these anti-abortion crisis pregnancy centers prevent women from obtaining comprehensive information to make medical choices. I'm deeply concerned that these crisis pregnancy centers do not follow HIPAA standards or medical best practices with regard to patient-centered care. My amendment is simple and commonplace, makes common sense. Before Section 2 of H.R. 6918 could take effect, the Department of Health and Human Services would need to submit a study to Congress with basic information about the state practice of using federal funds for crisis pregnancy centers. This is simple information for the states to provide. How much money under Part A is provided to these anti-abortion centers, and how many individuals have either applied or been referred to these crisis pregnancy centers? It is simple transparency. How are our federal dollars being spent by states to limit women's reproductive rights? Americans have a need to know. I thank you, Mr. Chairman. Urge passage of this amendment and yield back the balance of my time.
Does anyone else wish to speak on the amendment? Ms. Fishbach?
Thank you, Mr. Chair. And I just want to say, the underlying bill would ensure that states continue to have the flexibility to use TANF funds to support pregnancy resource centers. And that's, that has to be within the statutory purpose of the program. But I guess all of these kind of extraneous ideas that are coming through, I just want to remind people that the underlying bill is fairly simple, and all it does is make sure that states have that flexibility. And I oppose the amendment. Thank you, Mr. Chairman.
Are there additional individuals to speak? Seeing none, the question is on agreeing to the amendment offered by Mr. Davis. The clerk will call the roll.
Mr. Buchanan?
No.
Mr. Buchanan, no. Mr. Smith of Nebraska? Mr. Smith of Nebraska, no. Mr. Kelly? Mr. Kelly, no. Mr. Schweikert? Mr. Schweikert, no. Mr. LaHood? Dr. Winstrup? Dr. Winstrup, no. Mr. Arrington? Dr. Ferguson? Dr. Ferguson, no. Mr. Estes? Mr. Estes, no. Mr. Smucker? Mr. Hearn? Mr. Hearn, no. Mrs. Miller? Mrs. Miller, no. Dr. Murphy? Mr. Kustoff? Mr. Kustoff, no. Mr. Fitzpatrick? Mr. Stubbe? Mr. Stubbe, no. Ms. Tinney? Ms. Tinney, no. Mrs. Fishbach? Mrs. Fishbach, no. Mr. Moore? Mr. Moore, no. Mrs. Steele? Mrs. Steele, no. Ms. Van Dyne? Ms. Van Dyne, no. Mr. Feenstra? Mr. Feenstra, no. Ms. Maliotakis? Ms. Maliotakis, no. Mr. Carey? Mr. Carey, no. Mr. Neal? Mr. Neal, yes. Mr. Doggett? Mr. Doggett, yes. Mr. Thompson? Mr. Thompson, yes. Mr. Larson? Mr. Larson, yes. Mr. Blumenauer? Mr. Blumenauer, yes. Mr. Pascrell? Mr. Pascrell, yes. Mr. Davis? Mr. Davis, yes. Ms. Sanchez? Ms. Sanchez, yes. Mr. Higgins? Mr. Higgins, yes. Ms. Sewell? Ms. Del Bene? Ms. Del Bene, yes. Ms. Chu? Ms. Chu, yes. Ms. Moore? Ms. Moore, yes. Mr. Kildee? Mr. Kildee, yes. Mr. Byer? Mr. Byer, yes. Mr. Evans? Mr. Evans, yes. Mr. Schneider? Mr. Schneider, yes. Mr. Panetta? Mr. Panetta, yes. Mr. LaHood? Mr. LaHood, no. Mr. Arrington? Mr. Arrington, no. Mr. Smucker? Mr. Smucker, no. Dr. Murphy? Dr. Murphy, no. Mr. Fitzpatrick. Ms. Sewell. Chairman Smith.
No.
Chairman Smith, no.
Clerk will report the vote.
The ayes are 17, the noes are 24.
There being 17 ayes and 24 noes, the amendment is not agreed to. Are there additional amendments?
Mr. Chairman, I have an amendment at the desk.
Mr. Chairman, I reserve a point of order.
A point of order has been reserved. The clerk will distribute the amendment, and I ask the gentle lady to suspend while the clerk distributes. The gentle lady is recognized for 5 minutes.
Thank you, Mr. Chairman. While the legislation being offered by the majority today is very misguided, I do believe Congress should address TANF dollars going to deceptive pregnancy centers. I have been drafting and will introduce very soon legislation that will ensure if states are using TANF dollars to fund pregnancy or family planning, counseling, or care, then accurate and comprehensive information about reproductive care, including abortion care and out-of-state options, must be provided to patients. My legislation would also ensure TANF dollars cannot go to organizations who have been found to engage in deceptive or misleading practices. The federal government should have no part in funding programs designed to deceive or mislead women. These fake clinics have been known to assert untrue risks of abortions, including telling women medically inaccurate information, such as receiving an abortion would cause cancer. They've intentionally lied about how many weeks along a woman is so that she is falsely under the impression that abortion may no longer be available. And they've also intentionally misrepresented their facilities as legitimate healthcare clinics that offer comprehensive reproductive health care when they do not. There is nothing wrong with states offering parenthood classes or services to support young families, but women should not be tricked or deceived into receiving ideologically driven or so-called counseling when they believe they are receiving medical care. The amendment I'm offering today would simply prohibit TANF funds going to any organizations who have engaged in deceptive and misleading practices. I think we should all agree that misleading women is wrong. I urge my colleagues to vote yes on this amendment, and I yield back.
Mr. Stubbe is recognized.
Thank you, Mr. Chairman. I feel like I just looked it up, so I said the scripture correctly. I feel like I'm living in the times foretold in Isaiah 5:20. Woe to those who call evil good and good evil, who put darkness for light and light for darkness, who put bitter for sweet and sweet for bitter. I have a wonderful pregnancy center in my district, and I've sat here for most of the hearing. I had to step out, but I've heard these words stated from the other side of the dais. Propaganda centers, misinformation, they are a sham, intentionally lie, deceitful, dangerous. What was the other one? Oh, anti-abortion extremism. When these, at least the one in my district, lovingly care for the women who come into their center who are looking for some other option than abortion, and these families are put around and cared for, given, in the one in my district, they're given free ultrasounds. There are physicians there. There are techs there. There are medical personnel there. And to just completely upend, to the words of Isaiah the prophet, what is happening in these pregnancy centers that is good and loving and caring for young women who don't know what to do with their pregnancy and are looking for other options other than abortions. And we're here today because the Biden administration is attacking these centers through taking away funding that goes to them. This bill that Ms. Fishbach and Ms. Tenney have authored today simply state that TANF dollars should be able to go to these entities that are providing this type of care. This claim that this bill shows favoritism and partiality, it was the Biden administration who decided to attack PRCs by publishing a notice of proposed rulemaking, which I just went into. Not to mention the vitriol and the discourse that I've heard from the other side labeling these institutions and the way that they're labeling these institutions, demonizing these centers that provide loving care. And I wish I would have had enough time prior to this hearing to show a video of all the women who have gone through the pregnancy center in Sarasota County, who have had saved their babies, and they provide counseling for the fathers of these children, and the blessings that the pregnancy center has given to women and men in our community in Sarasota. And then they're completely demonized by comments made by the other side. And that leads to, our words are powerful. And it leads to these type of things: violent attacks on pregnancy resource centers. The pregnancy resource centers have been victimized by arson and firebombing, smashed windows, graffiti with threatening messages, destruction of signage, gluing of locks to prevent staff from entering, keying of staff members' cars, and other acts of violence and vandalism. Since the leak of the Dobbs Supreme Court draft ruling in May of 2022, pregnancy centers have seen a surge of attacks against them. Catholic Votes Tracker shows that there have been almost 90 attacks in 29 states and the District of Columbia between May 3rd of 2022 and September 28th of 2023, including the following: 1 in Missouri, 4 in my state of Florida, 2 in Pennsylvania, 4 in Ohio, 4 in Texas, 1 in Oklahoma, 1 in North Carolina, 6 in New York, 6 in Minnesota, 2 in Utah, 6 in California, and 4 in Iowa. The attacks appear to be organized under the umbrella of 2 domestic terror groups, Jane's Revenge and Ruth Sent Us, which has arisen since the Supreme Court opinion leak was published. Others appear to be connected to Antifa and anarchist groups. And then we hear from the other side today, and I'm not making these words up, this is what propaganda centers, misinformation, they are a sham, intentionally lie, deceitful, dangerous, and these organizations are extremist organizations because they're anti-abortion. Well, quite frankly, if anti-abortion position is extremist, then you can add me to that list of extremists, because I am anti-abortion. And I have that right as an American to be anti-abortion because I believe in life. And all of this bill does is go against a Biden administration ruling that pregnancy centers who lovingly care for these families in our communities, at least in mine. I can't speak to any of these other states, but I can speak to the one in Sarasota, and the satisfaction and success that they have had providing pregnancy services to young women and families is insurmountable, and it is certainly not the things that have been characterized by the other side of this dais today. I yield back.
Ms. Sanchez is recognized.
Thank you. I rise to support the amendment offered by Ms. Delbene. We aren't alleging these things. There is documentation and investigations, factual proof. In fact, the American Medical Association says that these anti-abortion counseling centers are widely considered to be unethical. And earlier I entered into the record an issue brief by the American College of Obstetricians and Gynecologists. And in that fact sheet, it said, what misleading practices do CPC staffs use? Asserting false risks of abortion, such as stating there are links between abortion and breast cancer, infertility, mental illness, and preterm birth, which is false. Falsely suggesting a high complication rate associated with abortion. Intentionally overestimating a person's gestational age and suggesting that they are beyond local legal limits for accessing abortion. using disturbing visuals or performing ultrasounds to emotionally manipulate and shame pregnant people under the guise of informing or diagnosing them, downplaying the impact of pregnancy and childbirth on people's lives and health, advertising online using keywords such as abortion clinic, and manipulating web search data to appear in searches for abortion clinics despite the fact that they don't provide abortion care, falsely representing the facility as a legitimate healthcare clinic that offers comprehensive and unbiased reproductive health care by selecting names similar to those of legitimate clinics, setting up near reproductive health clinics, and misrepresenting non-medical staff and volunteers as clinicians by having them wear lab coats and perform ultrasounds. My friends on the other side of the aisle, that is the AMA and the ACOG that have found these to be true. Now, with respect to this claim of violence towards pregnancy crisis centers, I would just remind my colleagues that that pales in comparison to the unrelenting violence against abortion clinics. In 2022 alone, there were at least 10 bomb threats, 73 hoax devices or suspicious packages, 92 reported incidences of stalking, 43 incidences of burglary, 218 reported death threats or threats of harm, 4 anthrax or bioterrorism attacks, and 20 clinic invasions, marking a major increase in violence against abortion providers and seekers compared to 2021. So we are dealing with facts here, not just mere speculation or innuendo or allegation. There are reports that have been entered into the record which show that these centers do not provide impartial, non-ideological, fact-based, medical-based, science-based information to the women who walk through their doors. And with that, again, I will say that I support my colleague Del Benny's amendment, and I yield back the balance of my time.
Mr. Hearn is recognized.
Thank you, Mr. Chair. I want to submit for the record a letter that I wrote alongside my colleague Brad Winstrup to GAO requesting an investigation and a report on the federally funded programs available to pregnant women as well as women and families with children up to 6 years of age.
Without objection.
Mr. Chairman, there are 90 federal welfare programs totaling $1.78 trillion, many of those providing resources such as food assistance, housing, and child care to support women and families caring for their children. The findings from this report will provide Congress with a comprehensive understanding of the current landscape of available programs and funding for mothers, bringing attention to key areas and opportunities for improvement. Government is not the only solution across the country. As we have been talking about all day, there are more than 2,500 pregnancy care centers dedicated to protecting life at all stages and providing new mothers with resources they need. Communities are a crucial component of the solution to serving women and children, and it's important we recognize the vital role they play today by marking up this bill to protect pregnancy resource centers and their ability to serve mothers. And I yield back, Mr. Chairman.
Ms. Chu is recognized.
Well, there have been several statements about these clinics being so wonderful, so welcoming, and so great. But I would like to tell you what one woman's experience was who walked into one of these clinics, Clearway Clinic in Massachusetts. This woman searched online for an ultrasound scan, and she came upon this clinic where they said that they would give her the scan. The paperwork that this woman received after the scan told her she had a viable in utero pregnancy, but she did not. As it turned out, it was an ectopic pregnancy. An ectopic pregnancy where a fertilized egg implants and grows outside the uterus, most often in the fallopian tube. Of course, such pregnancies are non-viable and they can be life-threatening. In fact, her fallopian tubes ruptured about a month after the ultrasound scan, causing massive internal bleeding and necessitating emergency surgery. This staffer did not have the qualifications to determine whether the pregnancy was viable. She missed the ectopic pregnancy because she wasn't qualified to do this. And in fact, the majority of crisis members, the staff members, are volunteers, according to the Charlotte Lozier Institute, an arm of the anti-abortion group. They found that at least 40% of the centers were even related to healthcare, meaning that the vast majority, 60%, are volunteers with no qualifications whatsoever. So that is what we are facing here with these crisis pregnancy centers, and they should not have federal resources devoted to them, and that's why I support Representative Delbenny's amendment.
Dr. Winstrup is recognized.
Just quickly, it seems like most of these issues that we're seeking amendments on are state issues, for one, and others may be malpractice issues. And I don't think we should be getting involved with malpractice issues up here. That's at a local level. And on just a point of reference, you kept referring to this as a clinic. You didn't refer to it as a pregnancy center. Was it a pregnancy center as we know them, or was it a clinic that committed malpractice?
Just to make clear, it's called Clearway Clinic in Massachusetts.
Okay, well, that would be different than a pregnancy center. I yield back.
Anyone else wish to speak on the amendment? Dr. Murphy?
Thank you, Mr. Chairman. Obviously, this is a very, very emotional issue with strong feelings on both sides. I'm pro-life, and I have no problem with that. I think there are a couple misnomers that are being said here. One colleague said that pregnancy centers were unethical. Good Lord, you're trying to save a life? How in the world is that unethical? I bet that person who had their lives saved doesn't think that they were unethical a few years later. In regards to the AMA and ACOG, where they declared abortion bans a violation of human rights, I respect my other medical institutions, but those places, we know where their politics lie. And I just find it unbelievable that we're thinking that health care is abortion. Reproductive health care, let me explain to you what reproductive health care is, because I've done part of that for many, many years. Those are called fertility clinics. They help people reproduce. So calling abortion reproductive health care is absolutely a lie. A reproductive health clinic is allowing a woman who has issues with her fallopian tubes or specific hormonal abnormalities, or a man who has Klinefelter syndrome, have children. That is what reproductive health care is. Abortion is the termination of a life. I don't know if anybody in this room has ever seen an abortion. I've been called in to fix a urologic problem on abortion, and when you see a baby's hand that's been separated from its arm, and you see its head that's been separated from its body, that's what an abortion looks like. So when this all we get with this touchy-feely thing about forcing people to have babies, this is all a direct result of the fact that we've lost our understanding that babies and sex have consequences. So, guys, literally trying to protect young individuals and young women who have a pregnancy, perhaps unwanted, to give them alternatives to life and let that child who was then fertilized and caused to be a life. Give me a break. How is that unethical? Think about that child and young parents who want to be adopted. How many times did I have to refer parents for adoptions when I knew that fertility was not an option for them? And what loving families, not single-parent households, did they go to? This is nonsense. Thank you, Mr. Chairman. I urge a no vote.
Does anyone else wish to speak on the amendment? Mr. Smith.
Thank you, Mr. Chairman. I yield time to Mr. Stubbe.
Thank the gentleman for yielding. I'd ask unanimous consent to add fire at New York anti-abortion facility investigated as suspected arson to the record. I also ask unanimous consent to add Des Moines registered Jane's Revenge Group claims responsibility for Des Moines Pregnancy Center vandalism, and federal agencies investigating suspicious fire at Gresham Pregnancy Center, local news, kgw.com.
Without objection, all three are ordered in the record. Further individuals wish to speak on the amendment? Mr. Smucker.
Thank you, Mr. Chairman. I've been listening to the debate today, and I can tell you I have several pregnancy centers in my area, and I've seen the work that they do. I've talked to the mothers who have gone to those facilities and have benefited, have healthy children as a result of the advice and care they received, loving care, as Mr. Stubbe said, they received at these centers. And, you know, one of the things that baffles me today, these were women who were making the choice to have a baby. They wanted to do that. They were not coerced in any way. And I don't understand why Democrats would be against funding for that care. Would you prefer an abortion over a live birth? I don't understand. Even if you are pro-choice, which I'm not, but even if you're pro-choice, why would you not want to support a mother who needs the care, who wants to have a healthy child? I don't understand. And I do want to respond as well to one of the things that we've heard, and that is that Republicans are not concerned about anything except preventing abortion. We just want to cut welfare benefits. We want to do nothing to assist single mothers after birth. And I take offense to that. And I want to remind my colleagues across the aisle that just last Congress, we passed the bipartisan Maternal, Infant, and Early Childhood Home Visiting Program, the McVie program. This, as you all know, is a program that supports low-income, high-risk pregnant women and parents and babies by addressing risk factors for maternal and infant mortality while enhancing overall health outcomes. And I have a great program, a McVie program, in my district as well that I'm proud to say that we have all supported that. So I just want to remind folks of that. We doubled the funding for the McVie program just last session, to not only ensure the continuity of vital services, but also to amplify the program's ability to serve more mothers and more babies. And I don't know that you could find any better evidence of our commitment to continuing to support vulnerable women and children. The evidence is right there. Thank you, Mr. Chairman.
Additional discussion? Seeing none, the question is on agreeing to the amendment offered by Ms. Del Bene. The clerk will call the roll.
Mr. Buchanan.
No.
Mr. Buchanan, no. Mr. Smith of Nebraska. Mr. Smith of Nebraska, no. Mr. Kelly. Mr. Kelly, no. Mr. Schweikert. Mr. Schweikert, no. Mr. LaHood. Mr. LaHood, no. Dr. Winstrup. Dr. Winstrup, no. Mr. Arrington. Dr. Ferguson. Dr. Ferguson, no. Mr. Estes. Mr. Estes, no. Mr. Smucker. Mr. Smucker, no. Mr. Hearn. Mr. Hearn, no. Mrs. Miller. Mrs. Miller, no. Dr. Murphy. Mr. Kustoff. Mr. Kustoff, no. Mr. Fitzpatrick. Mr. Stubbe. Mr. Stubbe, no. Ms. Tinney. Ms. Tinney, no. Mrs. Fishbach. Mrs. Fishbach, no. Mr. Moore. Mrs. Steele. Mrs. Steele, no. Ms. Van Dyne. Ms. Van Dyne, no. Mr. Feenstra. Mr. Feenstra, no. Ms. Maliotakis. Ms. Maliotakis, no. Mr. Carey. Mr. Carey, no. Mr. Neal. Mr. Neal, yes. Mr. Doggett. Mr. Doggett, yes. Mr. Thompson. Mr. Thompson, yes. Mr. Larson. Mr. Larson, yes. Mr. Blumenauer. Mr. Blumenauer, yes. Mr. Pascrell. Mr. Pascrell, yes. Mr. Davis. Mr. Davis, yes. Ms. Sanchez. Ms. Sanchez, yes. Mr. Higgins. Mr. Higgins, yes. Ms. Sewell. Ms. Sewell, yes. Ms. Delbene. Ms. Delbene, yes. Ms. Chu. Ms. Chu, yes. Ms. Moore. Ms. Moore, yes. Mr. Kildee. Mr. Kildee, yes. Mr. Byer. Mr. Byer, yes. Mr. Evans. Mr. Evans, yes. Mr. Schneider. Mr. Schneider, yes. Mr. Panetta. Mr. Panetta, yes. Mr. Arrington. Dr. Murphy. Mr. Fitzpatrick. Mr. Moore. Chairman Smith.
No.
Chairman Smith, no.
Clerk will report the vote.
The ayes are 18, the noes are 21.
There being 18 ayes and 21 noes, the amendment is not agreed to. Are there additional amendments?
Mr. Chairman, I have an amendment at the desk.
Mr. Chairman, I reserve a point of order.
A point of order has been reserved. The clerk will distribute the amendment, and I ask the gentle lady to suspend while the clerk distributes. Would the gentle lady is recognized for 5 minutes.
Thank you, Mr. Chairman. Today I offer an amendment to H.R. 6918 to provide affordable access to health care for all women of reproductive age. This amendment will prevent states from using TANF funding for crisis pregnancy centers without first ensuring essential services such as prenatal care, STI testing, gynecological services are also funded through a state's budget. Access to health care and health equity remain one of my top priorities, and this bill fails to account for health care funding needs to address women's health outcomes. Since the Dobbs decision, access to health care for women in my district, which consists of Birmingham, Montgomery, Tuscaloosa, my hometown of Selma, and the rural Black Belt of Alabama, continues to decline. Since November, 3 maternity wards in Alabama have closed. While only one of the maternity wards was in my district, patients historically served by the 2 wards that were closed have now traveled great distances to my district in order to receive maternal health care. This makes the need for maternal health care resources a major necessity for the residents of my district and our state. West Alabama Women's Center, located in Tuscaloosa, Alabama, is a perfect example of a health care center in my state providing vital medical services to women. Yet the center has been experiencing operational challenges due to political and policy decisions within the state that leaves the center unable to access state funding. In 2023, the West Alabama Women's Center served almost 1,000 patients and provided more than 1,800 services, including prenatal care, STI testing, and other gynecological health care services. The center has a full-time doctor on staff and also offers doula services to patients to assist with labor and delivery. West Alabama Women's Center also provides much-needed access to prenatal care, which has been the center's focus following the Dobbs ruling. Perhaps their most valuable contribution is paying for the treatment for patients without any form of health care insurance, which is key in a state like Alabama that did not expand Medicaid. The treatment covered by the center often includes diabetic services, STD treatment, heart monitoring, which are all necessary components of a positive maternal health outcome. In all, West Alabama Women's Center is offering countless tangible medical services to the most vulnerable patients in my district without any funding from the state of Alabama. This has created a funding crisis for the center, which expects to only have enough funding to remain open until April 2024. While we're considering funding crisis pregnancy centers, which do not, in contrast, offer comprehensive access to medical services, do not keep full-time doctors on staff, and are not ensuring patients are properly being linked to Medicaid providers, we must ensure that facilities like the West Alabama Women's Center are also being funded. These centers, which provide vital medical care to our constituents, must have access to federal fundings to keep their doors open. I urge my colleagues to vote in favor of this amendment.
Thank you. There's 2 votes on the floor. We'd like to finish before. Is there any discussion? Ms. Chu?
Yes, I strongly support my colleague Representative Sewell's amendment, which would ensure that before states divert needed TANF funds to these crisis pregnancy centers, they're sufficiently funding family planning programs. Our nation's family planning and reproductive health services are woefully underfunded, and that includes Title X, which is the only dedicated federal sources of funding for family planning. These are services like contraception, which most women will use at one point during their lifetimes. They are services like STI testing, cancer screenings, and preventive services like PrEP, which prevents patients from contracting HIV. So it is clear that there needs to be so much support for Title X, and it is something that serves 17% of U.S. women. But we need to do more. And with the lack of reproductive rights afforded to millions of women in the 21 states which have enacted abortion bans, family planning is more important than ever. And so these services provided by Title X have proven to be effective, and that is why I urge my colleagues to vote for this amendment. I yield back.
Seeing no further discussion, the question is on agreeing to the amendment offered by Ms. Sewell. The clerk will call the roll.
Mr. Buchanan?
No.
Mr. Buchanan, no. Mr. Smith of Nebraska? Mr. Smith of Nebraska, no. Mr. Kelly? Mr. Kelly, no. Mr. Schweikert? Mr. Schweikert, no. Mr. LaHood? Mr. LaHood, no. Dr. Winstrup? Dr. Winstrup, no. Mr. Arrington? Dr. Ferguson? Dr. Ferguson, no. Mr. Estes? Mr. Estes, no. Mr. Smucker? Mr. Smucker, no. Mr. Hearn? Mr. Hearn, no. Mrs. Miller? Mrs. Miller, no. Dr. Murphy? Mr. Kustoff? Mr. Kustoff, no. Mr. Fitzpatrick? Mr. Stubbe? Mr. Stubbe, no. Ms. Tinney? Ms. Tinney, no. Mrs. Fishbach? Mrs. Fishbach, no. Mr. Moore? Mrs. Steele? Mrs. Steele, no. Ms. Van Dyne? Ms. Van Dyne, no. Mr. Feenstra? Mr. Feenstra, no. Ms. Maliotakis? Ms. Maliotakis, no. Mr. Carey? Mr. Carey, no. Mr. Neal? Mr. Neal, yes. Mr. Doggett?